Dissociating Trauma, How Ketamine is Saving Lives and Paving the Way for the Future of Mental Health Treatment panel. Great to see this amazing gathering of people, happening here. So I just want to first start by thanking Pete and Colleen who have put Cannadelic together. I think many of us are going to be looking back years from now and remembering that we were at the inaugural Cannadelic event. This is like a pretty monumental moment. These seats aren't full. So just look around. You guys are the pioneers who understand in this early moment that these are the medicines that are paving the way for the future of mental health. So I'm really honored to be here with you. Thank you. So we have a great panel of incredible experts. Very honored to share the stage. We have folks from like the clinical side, from the advocacy side, from the legal side, from the marketing side, people who are working every day on the front lines of ketamine treatment to help people recover from trauma and move forward in their lives. So I know this is going to be a lively discussion. But I just wanted to start with a quote. Has anyone out there seen the documentary, The Wisdom of Trauma, with Dr. Gabor Mate, few people? I really recommend it. So this is just a quote from Dr. Gabor Mate that really resonates with me. Trauma is a psychic wound that hardens you psychologically, that then interferes with your ability to grow and develop. It pains you, and now you're acting out of pain. It induces fear, and now you're acting out of fear. Trauma is not what happens to you. It's what happens inside you as a result of what happened to you. So to me, when I think about this, trauma is not what happens to you, but basically how you're now going forward in the world because of that trauma. And I don't think that there is anyone here, especially anyone alive right now after going through this pandemic, that isn't going around in the world acting out of some form of trauma. And we've also found, not only that there's traumas that you experience in your own life, but that studies now show that trauma can be inherited and it is passed down in the DNA for 5 generations. So I'm sure we're going to hear some incredible stories from some of our panelists of, people that have recovered from trauma. But I also just really want to bring to light that we are all living with trauma. So it's remarkable that there's a medicine like ketamine that can help with it. So I will not jabber on too much. I'll just, first of all, introduce myself. I forgot to do that. I'm Kaya Roman. I wrote a book about the neuroscience of joy called The Joy Plan. And it's basically about, biohacking your brain so that you can experience joy. And then I learned about ketamine and I was like, actually, don't read my book, just go have some ketamine treatments because it does the same thing. So I'm a huge fan of the molecule. I work with a company called KetaMD that's bringing at-home ketamine treatments through telemedicine to really increase access, training doctors and nurses to be guides, and really training the people in the medical profession to understand the importance of this molecule and how it works. And I work with another company called Psychoceutical that is developing a patented form of ketamine that you put on the back of your neck that creates the same brain benefits without a psychedelic experience. So that's a really fascinating project as well. So I'm a huge fan of the molecule. I see it change lives every day. And I'm very honored to share the stage with some of these folks. So let me introduce who we've got up here. We've got Dr. Michelle Weiner. She is a cannabis and psychedelic physician. She runs a pain clinic giving ketamine infusions locally in the Fort Lauderdale area and is involved in some really fascinating research at the University of Miami involving both cannabis and ketamine. We have Lee Benson, who's a licensed mental health practitioner and director of integration at New Life. We have Warren Gumpel, who is the CEO of KetaMD and also the co-founder of the Ketamine Fund, which has to date given more than 500 free treatments to veterans who are dealing with PTSD. So Warren does incredible work every day. The other thing that, I know about Warren from knowing him for years is that what his real full-time job is stopping people from killing themselves. That's really what he does on the phone all day long. So this man is a saint, including me at one point. So he knows a lot about ketamine because of how it saved his life. We have Dustin Robinson. Some of you know him as Mr. Cannabis Law. Some of you know him as Mr. Psychedelic Law. But he is an incredible advocate for legal reform in this state and the country. He also runs an investment fund, ITER investment fund for early stage psychedelic companies. So he brings a very unique perspective on this from the legal and investment side. And we have Dr. Julia Muir, who is the Director of Strategy at Nushama. These are ketamine clinics in New York, and a consultant in psychedelic medicine. Dr. Muir was on a traditional medical path going into pediatrics and then learned about psychedelic medicine and realized, no, actually, that's where I need to put my energy because that's going to help even more people. So thank you for being here. And then we have Scott Thiemann, who is the CEO of Beyond Marketing, and he works with ketamine and mental health companies, growing and scaling, maintains an online community of over 600 mental health practitioners. I know we have business owners here who are really interested in the marketing side of things too. So great group of folks here. All right, so I want to get started with just a question about trauma, first of all, because this is, we're talking about ketamine, but specifically for trauma. And Warren, you have worked with so many veterans and so many people who've experienced trauma. Can you tell us your perspective on trauma and tell us some of the success stories that you've seen?
Yeah, well, first, to disambiguate the term trauma, I think, people think of trauma as that capital T of a trauma that they can look back and, very clearly, something like violence or abuse. And, we call these things traumas, but there's a little t trauma, which manifests into complex. It manifests into complex post-traumatic stress disorder, and these are small traumas that may not have even been things that we, realize about an impact on our emotional development. And this is where I think ketamine comes in, and one of the major functions of ketamine is building new neural pathways around these cortisol releases that have caused issues with normal mood development. So I think that what the ketamine does is kind of brings people back somehow to these cortisol releases. And I can tell you a story that's very common. I'm sure everybody up here is on stage has heard this experience of people going back to these traumas, whether they're capital T or lowercase t traumas, and revisiting them from a very objective manner, like being a third party in the room and witnessing themselves at a different age, in a foundational experience that they may or may not have known has been playing a major part in their personality and how they're living out their lives. So in the capital T trauma, through the ketamine fund, we've treated hundreds of veterans, combat veterans. Very common for them to go re-experience the hardest part of their life, which is, generally associated with violence and imagery that, compounds, and they, things that they're seeing every night when they try and go to sleep. They're able to revisit that trauma again very objectively and kind of take the electricity out of that kind of defaults them into these circuits that are anxiety driving and fear driving, and like Dr. Mate had said, just some of these things that cause you to act these situations out in your real life, and it's they manifest into depression and anxiety. So I guess some of the success stories is guys that are able to revisit those things, take the charge off of that, go back and sleep at night and re-engage in their lives, re-engage with their families. And in the lowercase t trauma, people that have gone to these foundational experiences and taken the charge, subconscious charges off of these things, and those, as they're re-exacerbated over time, again manifest into all of these manifestations of complex PTSD, like depression, anxiety, OCD, anorexia, bulimia. And we've seen people recover from indications that have been very difficult to treat and haven't had the right modalities of treatment in in modern psychiatry. So I think we're moving into this next phase, and I think ketamine is the first compound that skips us into this new generation of treating these things.
Thank you, Warren. Dr. Weiner, could you maybe explain to us why and how does ketamine do what he's talking about?
Sure. So ketamine is a dissociative anesthetic. So it's not a classic psychedelic, which is important to know because some patients actually won't benefit from the dissociation process because it doesn't allow them sometimes to connect with themselves. And so it's important to understand it's more of an anesthetic. It was first actually used for pain management. And that's really where these 6 sessions came from. Patients had chronic pain. They were doing multiple infusions of ketamine. And it was really actually for chronic pain. And then it kind of moved into the mental health space. So what happens is sometimes, let's say with a chronic pain patient, you have an initial injury. You have some type of stimuli or trauma. And the pain persists despite the fact that the stimuli is no longer there. So why does acute pain turn into chronic pain for certain patients? There's this increase of glutamate, which is an excitatory neurotransmitter. It's activating our NMDA receptor. Ketamine blocks that receptor. So it basically reverses something called central sensitization. And then there's also a lot of neuroinflammation involved in patients with depression and chronic pain. So it's an NMDA receptor blocker. And then that's kind of like the biologic mechanism behind it. And then you also have the neuroplastic changes. So after ketamine is given, there's an increase in brain-derived neurotropic factor. And you have that period of time where after ketamine, you have this synaptogenesis, or you're having this new building of neural circuitry. And that window is really important because you don't want to be under stress. You don't want to have a ketamine treatment and then go back to work. You know, that neuroplasticity is important for longer lasting effects. And then you also have the experiential component. The fact that the patient is having an experience, dissociation, for example, where there's the ability to have insight as to where their trauma came from, why they're in this loop thinking, why they have this chronic pain, trying to help them with their trauma. And we use it as a lubricant for during therapy. So if you're having ketamine treatments, you need to have obviously therapy so that you're prepared properly, but really to kind of get some more insight and then actually stop the path that you're constantly thinking, like the ordinary mind that we all have. Sometimes we just kind of need to get out of the way that we're thinking, and that's really what ketamine does. So it has multiple effects. It's not just a biological mechanism, but it's actually the experience, and then the fact that it does promote neuroplasticity allows it for the actual mechanism to last longer than just the one session you're taking ketamine.
Okay. Thank you so much for explaining that. Lee, I wonder if you could build on, yes, it's such a good, succinct, glad that was recorded. Yeah, good. We all need to memorize that word for word. Such a good description. Thank you. Lee, you know, Dr. Weiner brought up such a good point that in this time after the ketamine treatment, you're experiencing this neurogenesis, you have the ability to create these new neural pathways, you're seeing perhaps your trauma from a different perspective. As the director of integration, I imagine you have some wisdom you could share with us about, you know, how to really maximize that period of time so that people can get the full benefit from their ketamine treatment.
Absolutely. I would say, so using that 24 to 48 hour, or, you know, however long it lasts period of time to tune the neurons, right, the pathways in your brain to, in essence, being able to moderate your nervous system down if it needs, if you ride too high, and up if you ride too low. So learning techniques, practicing, we'll say practices, meditations, etc., is the way to use that critical period of time again to tune the neurons. So you can, it's really about what you expose yourself to. It's, you know, the meditations, anything you'd like to learn. That's your opportunity to learn. Your brain is going to encode something new, and it's in that period of time that it could be barefoot walks. It could be audios that you listen to. It could be, I'm repeating myself at this point, but different meditations, active meditations, audio meditations, anything of this sort, this is your critical period to really dial in and hardwire the possibilities for being able to moderate your nervous system on your own outside in the world.
Awesome. Thank you so much. What I find really fascinating is, now all of these psychedelic molecules are starting to be researched more and more. The research is coming out from top universities around the world. And from what I'm reading, they're finding psilocybin, ayahuasca, and ketamine, and I haven't seen the research on other molecules, but those specifically all do this same thing where they stimulate this new burst of dendrite growth in the brain and sort of create this window of opportunity to change your brain state. And so I have a question for you, Dustin. Ketamine, like, we all work with ketamine because it's legal in this country. But these other molecules, psilocybin mushrooms, ayahuasca, like, they're doing something similar in the brain. Do you have a perspective on why is ketamine legal and why are these other ones not?
So ketamine was approved as an anesthetic in the 1970s. So it's a Schedule III compound right now. And from this panel's perspective, it's essentially being used off-label. So off-label use the word is a little deceptive. It's totally legal and fine to do off-label use. Over, I think, 20% of prescription drugs are actually prescribed off-label. And what off-label means is that it's basically being used for an indication that it was not approved for. So it was approved as an anesthetic. However, we're using it for various mental and behavioral health conditions. The panel here is playing a very important role because I think most of these people are involved on the delivery side of psychedelic medicine, and the way these other compounds are going through FDA clinical trials is really under what we're seeing as a REM with the FDA. So a REM is a risk evaluation mitigation strategy which is requiring these compounds to essentially be delivered at a facility under the care of a therapist. So under the current paradigm for mental and behavioral health, a psychiatrist might write you a prescription, you fill it at a pharmacy, and then you go and you basically take it at home, come back to see your psychiatrist a couple months later. Under this new paradigm with psychedelics, the clinics play a very important role because these compounds will be administered at a facility under the care of a trained therapist. So MDMA is in phase 3 clinical trials for PTSD. Psilocybin is in phase 2 clinical trials for treatment-resistant depression and major depressive disorder. And then there's a whole slew of other compounds that are coming in behind it. So our fund invests pretty much at all parts of the value chain, from the supply and manufacturers of the APIs, the active pharmaceutical ingredients, the drug development companies, the clinics, and then the supporting technology and infrastructure as well. But we see the clinics playing a very, very important role. So basically, ketamine is Schedule III. All the other psychedelics, for the most part, are Schedule I. And now what's exciting on the drug development side is that we're seeing more psychedelic analogs and new chemical entities that are just psychedelic inspired. So there's a lot of innovation that's happening. These molecules are absolutely incredible. They do transformative things for a tremendously large amount of people. But there are ways to also optimize these compounds, and that's really what's being worked on by some of these drug development companies.
Thank you. It's an exciting time, like right at the beginning, really. So there is a lot of debate sometimes about, what is the ideal setting for a ketamine experience? Does the setting even make a difference? Is it just another drug that you could take in replacing, an antidepressant or something? I mean, I know somebody who went to a ketamine clinic recently for an infusion, and they were sitting in front of a TV watching cartoons, and that's what the clinic provided for them. So I wanted to ask you, Dr. Mirror, about set and setting, and I know you're involved with some clinics in New York. What difference does that make to how this molecule works and interacts, and what kind of result people will have?
Sure. So I can speak to the ketamine part. I'm also involved in psilocybin research.
And
So,
please speak about that as well.
and there we have very carefully curated the setting for the room. It's a very like everything, the lighting. We made sure that the lighting could be dimmed. We have a very beautiful, comfortable couch, which is my colleague Scott will attest to this. It's like great for the laying session, but not for the sitting session. But we have no mirrors in the bathroom because of all the conversation about, do you look in the mirror? Do you not look in the mirror when you're on a dose? So we're very careful with that because you don't want to come in and feel like you are in a clinical setting. This is a very different medicine, as you said. For us at Nushama in New York, our flagship clinic, it looks nothing like a doctor's office. We have beautiful artwork. Our wallpaper is artwork. We have plants and nature everywhere just to kind of create a more serene environment so that when you're coming into a session, we know that set and setting is very important. The mindset can be influenced by the environment as well. And in terms of, we're an IV clinic. We do IM for group sessions, but a lot of doctors may forget who their clients are. So one interesting conversation I had with a veteran, he was like, I don't really want to go to a clinic where I'm hooked up to an IV because this reminds me of the months I spent after I got back in the hospital. And that is not what you want to set somebody up with as they're going into this dissociative state. So that's one thing. And then when they're coming back, you don't want anything that's going to be too jarring, bright lights, loud sounds, anything that will potentially, be deleterious to the person's experience. So I think that it's very important. And I think that what's been amazing to see in the last couple of years is the shift in the narrative. Even IV clinics that have been saying, oh, we're only IV, therapy is great, but, do that on your own. Even they're bringing in therapy. They're bringing in things. They're changing their offices. Like now we're all collectively saying what's going to be better for the patient.
Okay, wow, thank you so much. When you said, thinking about who is the patient, like who are these people really that are seeking this treatment, it made me think of you, Scott, and how, you're really reaching out on the internet and through marketing, and which most of us are involved in companies who are interested in marketing. Like, I'm curious from your perspective, who are the people that are seeking ketamine treatment, or who are the people that should be seeking ketamine treatment, and how do you reach them?
Absolutely. And it's a really great question because people who are suffering from mental health disorders, a lot of them suffer in silence. So a lot of times you don't know who it could be. It could be anybody. And really, when you look at growing your practice, because everybody up here is interested in not only growing their individual companies, but the whole field, marketing needs to be a big part of that. And because this is still such an unknown, we want to maybe replace the word marketing with awareness and education. And so the approach that we take with our private clinics is, how do we get people aware of this type of treatment, and how do we make it compelling so that they can raise their hand and say, hey, this is something I'm interested in, without feeling, that it's going to be a bad experience. So having a clinic set up the right way, that first person, that first touch is so important. Somebody needs to be both medically minded, but also trained well to be able to work with people, to be able to handle objections. So not only do you have to have that part dialed in, but video is a great way to reach people. So there are some ketamine clinics here I know that have great video content. You have to be careful online with big tech using ketamine, using cannabis. You could get totally blacklisted, which is not good. So video is a really great way to educate people. A lot of people suffering from depression are insomniacs, so you can run video 24/7. But you don't know who is suffering. So by exposing your whole geographical area to the right video content is an approach that we take that works really well with our ketamine clinics.
Okay, thank you so much for sharing that. So I think, we have an interesting mix here on the panel of doctors who are involved in, physical clinics, and then some folks who are offering ketamine at home through telemedicine. So I want to hear from the telemedicine folks on set and setting and sort of like clinic versus at home. Is there a place for both? Is one better than the other? So let's start with you, Warren, on the at home experience.
Well, I can start with, I received my first ketamine treatment 6 or 7 years ago. So I have spent the last 6 or 7 years as this is my full-time job. This is my hobby. This is everything is the education and awareness of ketamine. So my first treatments were in an infusion center in Manhattan. There was not a lot of set and setting. It was on Maiden Lane, the street next to Wall Street. It was a room in a dentist's office, and Dr. Glenn Brooks, who is a real saint, he's an 85-year-old anesthesiologist, and he does this for cups of coffee for people that couldn't afford it. So there was no advocacy. I didn't know what to expect. Still, after 10 years of suffering from horrific suicidal depression, I snapped out of it after 2 treatments. So set and setting is extremely important. In some other ways, getting ketamine is, for me, more important, especially in a triage situation. So it's great that it's evolved into this space, but that's where it started. And then over the next couple of years as an advocate, I'd speak to people every single day. Clearly, they all could benefit from ketamine. Unfortunately, very small percentage of those people could spend $500 to $1,000 a treatment, go into a clinic, have someone drive them there and back. So that's when Zappy and I, started the ketamine fund to start addressing those people. Of course, the people most in need at that point and now neglected part of society, unfortunately, are veterans. So that's where we started. And then, the whole thing for us about developing KetaMD, which Kaya has been an amazing part from the beginning, and a lot of other people here, is accessibility to this compound, which, again, it can't be a class or economic thing. It has to be accessible to everybody. So are there environments that are more ideal? Yes. Would I like to stay in a Four Seasons? Yes, but I'd like to go on my trip. And if I have to stay in a Holiday Inn, I'll stay in a Holiday Inn. And that's not the distinction. You have to get there. You have to get it going. So for some people that can afford to go on retreats to Costa Rica, I encourage them to do that. If they can sit with a psychiatrist and a nutritionist and have some of these, extra benefits, then please go ahead and do it. We need access to more people. There are so many people committing suicide. There are so many people suffering in silence. It's the biggest drain on our economy, the workforce. It's disrupting family units. So for me, accessibility is our primary focus. And then, again, integration, super important. We have mechanisms to do that, inexpensively. We think life coaching is a great option when you're in that neuroplastic state, instead of revisiting, past traumas and talking about perhaps your relationship with your parents when you were, in 5 or 6 years old. Instead, let's implement practices moving forward while you're in that neuroplastic state. Again, meditation, going for a walk, exercising, changing your diet. So all of these things fall back to me to one thing, which is accessibility to a broader population. So clinics are amazing, saved my life. At home, I'm watching it every day, lives being saved. So if you can get ketamine, you get it any way you can if you need it. And if you can afford to go to Costa Rica, please go to Costa Rica to take the time off. If it's more of a stretch, figure out a way to do it. And there's great ways to be treated at every price point.
Thank you, Warren. Lee, can you add on to the at-home model of offering ketamine, like what you guys do with New Life?
Sure. I would say the main idea really sort of beyond the ketamine or any molecule, right? As you were mentioning, there are many, or somebody was mentioning that, is that the idea is, once you get a reset with, say, whatever molecule, ketamine in this case, what you want is to be able to take your ability or build an ability to moderate what's going on in your nervous system at any given moment. So the accessibility of at-home ketamine being a really valuable asset, for a large number of people, comes along with access to, in the case of New Life, an app that really helps people build the skills, do the integration, right? So the skills being building awareness, and then of what's going on in your nervous system at any given moment, right? Am I high energy? Am I aroused? Am I fatigued? Does that feel pleasant or unpleasant? Do I have an idea of why? So building that ability to really notice where you are so that you can either dial yourself down if you want to or bring yourself up. So this app or New Life's app being a place to engage with different practices to build awareness and then practice expressing and grounding and grounding, breathing, and expressing. Really, the sort of the trifecta of being able to shift your nervous system state on your own. And so, really building those skills at home after your at-home experience really can be done after any type of experience, but really being able to do it at home after your experience right there with the app is that's what we're doing at New Life, and the value of being able to do it at home right there in the app after you complete your experience.
Yeah. Thank you. It is amazing to see how far things have come. Warren and Zappy made a documentary that you'll get to see part of this evening when Zappy speaks about Lamar Odom, the basketball player, former Kardashian. Some of you may remember he had a very public breakdown in 2015. Overdose, almost died. He had 6 heart attacks and 12 strokes, and even after that was still struggling with addiction. And it was going with these guys to ketamine clinics and doing ketamine treatment, and then after a series of ketamine treatment, going to Mexico and really, hitting it hard with ibogaine, that broke Lamar of his addiction. And I came in later on that film and was one of the final producers and post-production people on it, and I got to work closely with Lamar too. And I mean, he's a celebrity, so everybody feels like they know him. But of course, we work with people all the time that have a similar story where they've tried everything and they've even been through the most extreme experiences, and ketamine is really what helps them recover. But what I started by saying was this movie with Lamar Odom and just all of the work that people on this panel and other people in the ketamine industry have been doing over these past several years has really changed the awareness and acceptance of this. You probably aren't hearing as frequently as you used to, oh, isn't that a club drug, or isn't that a horse tranquilizer, or like, isn't that something bad? And it's really being accepted more, like, oh yeah, I heard about that, and my cousin tried that, my mom tried it, I really heard that helps with depression or with trauma or with anxiety. And now even apps where you can do it at home and get supported in your ketamine journey through an app. It just makes me so happy to see how far these things are coming, and that this is really being more brought into the mainstream. And I just wonder, we are still at the beginning, so I wonder how much farther we will go. And so I'm going to throw that question to you, Dustin, because you're working on, changing laws, and also you're seeing through your investment fund what all these cool, interesting startups are doing. So where do you think this is heading?
So we've talked to probably over 500 early stage psychedelic companies. So we certainly see a lot of different stuff. Really right now where we're mainly focused from an investment perspective is on the pharmaceutical side. So I know a lot of you guys come from maybe the cannabis industry. This is very different. These are companies taking drugs through FDA clinical trials or Health Canada or whatever jurisdiction they're really in. But what my nonprofit focuses on is actually city and state legalization. So we've seen really an explosion over the past year of cities decriminalizing, and then you have states like Oregon passing Measure 109, which actually creates a legalized commercial framework. So the difference between decriminalization and legalization, it's important to understand that. Decriminalization is just decriminalizing possession and use. Doesn't create any sort of commercial market, so not really an opportunity from really a business perspective. Legalization creates basically a commercialized framework. So in Oregon, for example, they'll have licensed cultivators, they'll have licensed service centers, and they'll have licensed facilitators and licensed testing labs. Where it looks much different than cannabis under the Oregon framework is that rather than retail stores, I get a lot of people reaching out to my law firm, because I also have a law firm, and they want to start like retail brands around psychedelics and, you know, do a cool brand or with psilocybin or DMT, whatever it might be. And the reality is, even under the state legal framework that's being rolled out, it's required to be delivered at a service center with a licensed facilitator. So it's really not a retail model where you're going to go into a store and there's going to be shelves with product on it. It's more similar to going into maybe like a clinic that's, you know, delivering you medicine, is kind of what it looks like. So here in Florida, we filed a bill last legislative session, didn't pass, but it got the conversation started. There was another bill filed this legislative session, much tailored down, mainly around research. So, you know, I think we're going to see this industry evolve. I think it's very early on the city and state side. I think really what is leading the way right now is the pharmaceutical research. And I think the research that gets done at a pharmaceutical level will also fuel the city and state legalization as well, because it will destigmatize what we know. Incredible research coming out of Imperial College of London, Johns Hopkins, Yale, NYU. Essentially, most of the companies we're investing in are licensing out some of the research and the science that's coming out of some of these really highly esteemed institutions. So it's really about proving it out through the research, taking it through clinical trials, breaking the stigma. And I think we're going to see this industry really explode over the next 5 to 10 years.
Thank you. And it's great to hear that. Yeah, thank you so much. And thank you for the work you're doing to make that happen. What I find, you know, really cool about what we're doing with ketamine, you know, with platforms like KetaMD and New Life and apps and these clinics, is like ketamine is the molecule that we can work with right now because it is off-label, FDA approved. But we are setting up this framework so that when these legalization measures pass, city by city, state by state, and hopefully, you know, nationwide, we've got the framework then where you can do your MDMA treatment or your psilocybin treatment or ibogaine for addiction. So yeah, it's very cool how, you know, we are learning now, sort of proving out the model with ketamine, but the other molecules are to come. But you mentioned research, and that made me think of what I wanted to ask both Dr. Weiner and Dr. Mirror, who are involved in research. What research, if you could tell us, you know, are you involved in, or do you see that's happening with ketamine right now that's exciting?
So I have one study going on with University of Miami and Shari Kaplan, who is a therapist I work with for the ketamine patients. And so what I actually learned from the cannabis industry was personalized medicine. And we learned that from the plant and from the endocannabinoid system. And I think psychedelics, especially ketamine, is very similar in the sense of, like we're talking about, different routes of administration, whether a patient is going to have an intramuscular, an IV infusion, an oral route at home, in the office, what dose, if it's going to be sub-psychedelic, full dissociation type of experience. So the research that we were doing is basically comparing an intramuscular route of administration to a microdose of ketamine during therapy for chronic pain and depression patients. And we lumped chronic pain and depression together because everyone who has chronic pain pretty much has depression. And there's this concept of neuroinflammation, which is really involved in both diagnoses. And the fact that, honestly, we're trying to get away from having a specific diagnosis so that we have a specific medication to give a patient. It's better to look at the person as a whole person and treat the entire person. So anyway, we are comparing the two routes, a higher dose of an intramuscular dose over 6 sessions with 7 sessions of therapy compared to low dose of ketamine, actually ketamine-assisted psychotherapy, where the patient's able to talk to Shari during the ketamine experience. So we're using it as a catalyst in both sense, but they're both having the same therapy. However, it has to do with the dose and the route. And we actually are analyzing the data right now, but the concept really is why, you know, do we need to dissociate in order to have either pain relief or to treat our depression? Is the need to dissociate part of this? And actually, the research is really not sure. There's a paper that actually just came out recently that said the degree of dissociation is not related to the antidepressant effect, which is very interesting. I'm really trying to bring chronic pain and mental health together and try to explain to people that pain is more than just the physical structural tissue damage, but that people are having a sensory emotional experience attached to this. And so that's why we're really studying chronic pain and depression patients. And what's happening is that both are getting better, right? So we're doing higher doses of ketamine with therapy versus lower doses with therapy. And the emphasis is on the therapy, is on the integration, is on the preparation. And the medicine does so much, but the patient also has to do the work. So it's not that the ketamine is doing work on its own. The patient is also doing the work. And that's why the therapeutic alliance is extremely important, which is basically a three-way between the patient, the therapist, and the physician. Sometimes at home is a great option. I have patients that I will do a few sessions in the office, like 3 intramuscular doses. They do fine. And then I send them home with a prescription. They contact me, and I know exactly when they're doing it. They already are aware of what's going to happen because they've done it in the office. So there's something for everyone. There's a model that, I think it's important. I just want to say that, like, we're all on this panel, and maybe we all have different businesses, but for the right patient, there's an option. Whether it's going to be a high dose in the office, at home, the most important thing is preparation, safety, and integration. I got off topic.
No, that was great. Thank you so much. That was wonderful. And how about you, Dr. Mirror, on the research side of things? What do you see that's exciting? And if there's research that you think is still needed, what would you say?
What's exciting is Dr. Wiener's research, because I've been saying this for a couple of years. There's data out there now. It's 6 sessions over 2 to 3 weeks, and everybody just keeps repeating this. And why do we repeat this for studies? Well, because if this protocol was approved, it's much more likely to be approved if you just suggest that same protocol with a few tweaks. And the reason why this is unfortunate for us is because now we have a lot of people interpreting this data however suits their business best. And technically that is the data that's out there. What we need is more data looking at the integration, looking at the preparation, looking at exactly what Michelle is looking at. Is it about the dose, or is it about the things that the dose makes you more receptive to? And I said this on a previous panel, and I'll repeat it again. With psychedelics across the board, if we look at these as just the molecules that are going to save us, we are going to miss an opportunity to really heal on a mass level. This is about reminding us what works. So many of us have spent decades in therapy on all these medications. Nothing is helping. So how are you going to tell someone like this, change your diet, start doing yoga, sleep at, great. Logically, this makes sense, but people are so resistant to all these modalities, they assume it's not going to help them. So guess what? It won't. The ketamine, whatever dose that this is at, whatever dose is right for you, the goal is that it makes you more receptive to those things that can actually make you better. Unlike other psychedelics where, you have this one dose and then a year later, 5 years later, you still have all these great insights. Ketamine, for the most part, you do need it more often. And that's okay. But we need to be mindful of the fact that this is not exactly how the other ones are. And all of this, at the end of the day, has to come back to what the person is ready to do for themselves to be better.
Yeah, thank you. Great points. So I'm wondering for you, Scott, we're talking about, and it's true. I mean, I wrote my book, The Joy Plan, trying to give myself and people very specific, easy things you can do every day to feel more joy. But some of those things, even if they seem simple, are hard to do, like stop eating sugar, exercise, whatever. So, but it's true that when you have a ketamine treatment or you have a psychedelic experience and you get, like Dr. Michelle has explained to us, this burst of new dendrites and you have this new neuroplastic state in your brain, you are more open to the daily habits that Lee is talking about, that you have to do, the meditations and the breathing and the exercise and all the things that help us keep feeling good. That this ketamine isn't just replacement antidepressant. And so I'm wondering, how do we communicate with people as a communicator? You know, how do we continue to destigmatize? Sometimes I wish we could change the name of ketamine to something else. But anyway, how do we continue to destigmatize it and get people over to understanding that this is part of a holistic wellness program?
Absolutely. And that would be great too, big tech wise, to be able to explicitly say that on platforms like Facebook and Google as well. But I'm going to lean into what I was talking about earlier. You need to have a part of your growth plan budget allocated to education and awareness. And video is going to work best. There are some clinics here today that we work with that have amazing video content, and it makes our job super easy. So I think if everybody here is willing to take a stand, and time and money follow all commitments. So if you're willing to put the time and effort and the money behind getting high value video production made, and then being able to either yourself or work with a trusted partner who can get that message out effectively, that's going to be one of the most important ways to continue to propagate ketamine and these new alternatives. The other thing is, Tony Robbins talks about there are 5 core functions to growing your business. There's lead generation, there's lead nurture, there's conversion, there's delivery, and then there's upsell or referral. So number one, I wouldn't start a business unless you had really great delivery. And that's what some of these amazing medical professionals are talking about, the quality of the delivery of the actual ketamine and the research. And so what's really important too is to be very, very intentional about how you generate a lead and how you nurture a lead. So referral is the best, right? Because if you have a good reputation and you have a good online presence and you have a good business, referrals are going to carry you a long way. The only problem with referrals is they're not always predictable. Maybe you have 20 new patients one month from referrals, you have 5 the next month. So that's great, but it's not as predictable. And so when you're really intentional, every single person who inquires about your service, about ketamine, about how you can help them, to be super, super intentional in that lead nurture process. What are we saying to them? How are we communicating with them? Again, video, text. We use text in a HIPAA compliant environment with our private clinics, and really meeting the patient where they're at, and then having the right team, because you need to have somebody who is very empathetic, and as well having somebody who is medically able to communicate as well. So if you're able to assemble the right puzzle pieces in those 5 core functions, that's what's going to make for a successful ketamine clinic.
Okay, awesome. Thank you. So we have some, I know about this panel, incredible brain trust here on stage. We have some time for questions from the audience. So raise your hand. I will call on you. If you want to direct your question to someone in particular, just say so. Otherwise, we'll decide who should take it. Yes. Okay, sounds like Justin's going to take that one.
What's happening right now is the large pharmaceutical companies, for the most part, are sitting on the sidelines. Johnson & Johnson did come out with esketamine, so Big Pharma is getting involved to some extent. But for the most part, they're sitting on the sidelines, and they're letting these small biotech companies kind of duke it out. And the ones that will win, they will probably acquire. It's important that we do get Big Pharma involved, because from a commercialization perspective, this is very, very complicated. We, talk about access on this panel, and quite frankly, many of the companies that we are investing in don't quite have the platform to properly commercialize these. So what will most likely happen is you will see Big Pharma getting in. We saw it in the cannabis industry with GW Pharma selling to Jazz for over $7 billion. GW Pharma is basically, they produced Epidiolex. It's a highly concentrated version of CBD that they took through FDA clinical trials. But I think that's just kind of an example of where the psychedelic biotech industry is probably going, is that as a company takes their compounds through FDA clinical trials, probably gets approval, you'll start seeing big biotech get more involved. There was actually just an announcement that Otsuka did a deal with Mindset. Mindset is a psychedelic company. Otsuka is a huge pharmaceutical company. So we're now starting to see some of these different deals being done with the psychedelic startup biotech companies and big pharma. And hopefully, no, I mean, whether they'll corrupt it or not, I mean, big pharma is big pharma. But in a lot of ways, they're a necessary evil because we need them to get involved to bring the amount of capital required and the platform that we need to properly commercialize these compounds.
Yeah, I mean, starting on this journey, that was a huge concern. Is this big evil empire that's looking to take the soul out of this? The truth of the matter is they're interested in making money. These things actually work. Like Dustin said, there is a huge infrastructure. There's also a lot of obstacles that lie in the way of getting a drug commercially approved, and a lot of that is money. And the way that our society is set up and the way that we're set up in this capitalistic structure is you need that money. And at the end of the day, these compounds work. They're already selling medication that's not working very well. So if that's the deal with, if you want to call it the devil, it's not the devil. It's just a machine that moves forward in order to make money. So they're not against ketamine or psilocybin. Once it works, they will jam it forward. And at the end of the day, we're in a society that's suffering in major pain. And if that's the vehicle that moves it forward, we have to embrace that. Again, I started out, thinking this was an oppositional thing. It's not. It's just the vehicle to move this forward and create healing, we hope.
I'm getting the signal that we need to wrap it up, so I'll take one more question. This gentleman here. Yeah. Right. So this is a question about legalization and rescheduling, and I just want to clarify. So for ketamine, ketamine is legal. It is Schedule 3, right? It's Schedule 3, so it has to be prescribed. But it is recognized to have medical benefit. At the moment, it is the only psychedelic medicine that is Schedule 3. The others are Schedule 1, which is they're considered to have no medical benefit. So again, maybe this is a question for you, Dustin.
Yeah, so Schedule 1 means no medicinal value and high likelihood for abuse, which the research has already very, very clearly proven that these compounds have no business being within that Schedule 1 category. So we're like literally living in a world where the FDA, the federal agency responsible for overseeing drugs, has designated MDMA and psilocybin as breakthrough therapies. Yet the DEA has these compounds as Schedule 1. So it's like a complete paradox that we're currently living in. Unfortunately, to get these things descheduled is extremely complicated unless you go through FDA approval. So the normal process, if we get these compounds approved, such as Epidiolex, what happened with that, it got FDA approved, and then it was essentially rescheduled to Schedule 3. So the quickest, in my opinion, and best way and most likely way to get these compounds descheduled is to prove out the research through the FDA, get them approved, then it will get kicked to the DEA, and they'll have 60 days to essentially reschedule it as either Schedule 2 or Schedule 3. And then even what a lot of people don't realize, like 26 states don't automatically adopt the federal scheduling program. So then those states will also need to be lobbied to deschedule as well, or reschedule, not deschedule.
All right. Well, I want to thank each and every one of you for sharing your expertise. Really incredible panel. And thank you all for coming. And thank you for being advocates for this medicine.
Thank you.
I'm super excited about what you're doing.
Such different. So interesting. I didn't know. Thank you. Good job. Good setup. Good tech.
Yeah, right. They're still recovering.
I jumped in on tomorrow morning. 10 in the morning. I'm like, well, it's 10 in the morning on a Sunday. I don't think you want to do
Yeah.
I'm gonna party today.
Should I try the rest of you? Are you moderating or? Yeah. Oh, okay. Gotcha. between for the so 6 total, right? I think so. Yeah, yeah. Yeah, you're doing double, right? We're in the 7 days a week. There's somebody that left this table, and it's little missiles. I was looking and it didn't pop it yet. Oh, here it is. Thank you. No, it's edited in email, but I don't think it says it. Looks like they do any school work for them. Yeah. There's a guy. Hey, buddy. How are you? Fine. Yeah. Nice to meet you. I was born in Colombia.
Oh, cool. I was just there.
Yeah?
Like 2 days ago.
Yeah.
Medellin.
Nice.
Yeah. Welcome to the day.
Are you traveling or
Both. Yeah. I'm nomading, so I just go different places, hang out, work. Yeah. I love Medellin. It's my new favorite city.
Hang out there. Gosh, that's good. The weather, the people.
Yeah, exactly. The food's good.
Have you guys switched?
Sure.
Switch? Yeah. Okay. That's the team that you really set up. So you're moderator, right? No, the moderator's there. Oh, you're moderator. Is it okay if I sit here? Is it like more flow? Yeah, if you want to go ahead. I erased the creating in the middle, but that's fine. I think it's better. I agree with you. It's a little conversation. That could be a lot of attraction. Playing against you on that one. That's the way she goes.
Good. How are you? Josh. Nice to meet you.
It's always right. Hey,
Hey, how's it going?
Santiago.
Yes. You're friends with Stormy, right? She told me to tell you hello.
Okay.
Yeah.
Sure. You want me to go this way? Yeah. Because I can't see the moderator. So. No. Yeah, you want that for sure. Get started. Maybe we're running late already, so we can get started. Okay. Waiting for Jared.
Yeah, we're supposed to.
Yeah, it's got the name on it, I guess. Who's on?
Hello, everyone.
Is Garen here? Yeah, there he is.
We're going to give a few more minutes for people to find their seats.
Pickleball injury. Pickleball. How are you?
Thank you so much.
All right, how's it going? Josh.
Yeah, John. Really excited. Did you like it? Did you see
Hey,
the
how's it
physical?
going? I'm Garen. It's great to meet you. Oh, nice.
Hey, Garen.
Thank you. Thank you. Do you used to live in Baltimore? I live up on Oh, nice. Very cool. Very cool. Awesome. Thank you. Thank you. I appreciate that. Thank you.
Okay, we're running 10 minutes behind, so if everyone could please take their seats and we'll get started.
What's up, guys? I'm at Cannadelic, about to speak. I'm at Cannadelic, about to speak on branding.
Welcome everyone to the Cannadelic panel. It's great to see the amount of people from Miami or coming to Miami to discuss cannabis and psychedelics. We have a great lineup today. So I'd like us to start by briefly introducing ourselves and sharing a little bit of what we do. Tim?
Well, thank you. I'm Tim Blake. I'm the founder of the Emerald Cup. It's our 18th year out in California. We're the largest sun-grown cannabis competition in the world. And I'm 65. I started interacting with cannabis and psychedelics 50 years ago. So I go over the last 5 decades watching it, the evolution of this. And I'll just say a quick note about cannabis and psychedelics were interwoven through all those decades in the 60s and the 70s into the 80s. It was when they built the private prisons and made the federal minimum mandatory prison sentences, they got separated. And then cannabis had to take like a 30-year path towards legalization, while psychedelics had to really go to the background because people like my friend Seth Ferrati ended up getting 21 years in federal prison for just a couple 100 hits of acid. So we really watched that. And then, of course, we came into legalization in California in 2016, heading into 2017. And that really broke it down. But it was an amazing process because I voted for that. I was really a big proponent of Prop 64 because they weren't going to allow large-scale farming. And 2 months into legalization, they did. And we knew that that was going to be the end of small farmers and legacy brands, which I'm really a proponent of. That's where I come from. And so you have to be really careful. We're talking about brands up here in the similarities because of that, over the next 5-year period, we've now reached a point where last year they grew 8 million pounds of cannabis in California. And it's an extinction event going on for small farmers. Between 50 and 90% of those farmers won't be in the industry next year because prices have fallen down to £300 for sun-grown, $400 to $500 for mixed light, and there's no way they compete with these large farms. So at the same time, psychedelics came in, and over the last 14 months, they started exploding. People came to me and asked, they were looking for boxes of psilocybin. A box is 100 pounds. That's what they use for cannabis out in California. And 4 different people in the course of a month at the end of 2020 came and asked for boxes. And I was like, what the hell is going on? I was like, well, I hear everything on the streets, but it was mind-boggling. So the prices were $1,200 a pound back then. Fast forward 14 months, that price has already dropped to $500. And it's going to be $300 by next year because unlike cannabis, psychedelics don't need, or psilocybin doesn't need that massive sun outdoor farming. So you're going to see, barns, warehouses, shops growing all over the country. And so both legacy psychedelic farmers and psilocybin and cannabis farmers are facing extinction events in the near term. We can talk about that more, but it's really a very similar process we're going to see going on.
Thank you, Tim. Patrick?
Hey, I'm Patrick. I'm the president of Microdose. We're a psychedelic media company. We do events and creative content and communications in the psychedelic space. We've been around since April 2020 when we did our first virtual conference, and we did our first in-person conference in Miami in November. It was called Wonderland, and we'll be back next November.
Awesome. And thank you for bringing that conference to Miami. It was absolutely amazing. I'm Juan Capello. I'm the CEO of New Life, a next-gen mental wellness company that's using at-home ketamine to help people reboot and reset. We're a public benefits corporation. We have the express goal of helping 1 million patients heal their trauma and disease before psilocybin becomes legal. I was raised in the Native American church in South America. Started the Native American church here in South Florida about 10 years ago. And that's always been the container I've been most comfortable with. But given the huge need coming out of COVID, we decided to decided to follow my mother's advice that she would always say that with discomfort, you can begin to grow. And it was uncomfortable for me to move into the medicinal space and out of the Native American church. And that's what we've done. And we've facilitated 22,000 psychedelic experiences to date, safely, effectively, thank you, and ethically. So thank you all very much, and looking forward to this conversation.
I'm Garen Angel, CEO of Magical Brands. I've been in the cannabis industry since 2010 when I started making my first investments. The first magical butter machine. Awesome. So, really amazing. We have over 420,000 customers around the world. So we are one of the largest cannabis brands to date. And for us, we've known that mushrooms were going to be part of this movement. The very first magical butter machine had a mushroom button on it. Recently, we rolled up and acquired the word magical around the world. So we own magical.com, Canada, any of the top level domains. And that's our activation for psychedelics. And we really see this as brands. And I'm very excited about the panel today and to be up here with these legends. I'm friends with a few of them for quite some time and love it. When you look at Propecia or Viagra, those are compounds and those are brands. And the reason why they're prescribed is because a doctor or a patient asks for it by name. And that's where we see psychedelics moving, no different than the cannabis industry. Brands are everything in the cannabis space today, and we really see that as a no-brainer in the psychedelic space. So we're in the process of moving into psychedelics in Canada and doing some clinical research here in the States with the university. I'm a big believer that, the true definition of a billionaire moving forward is someone who helps a billion people. And that's what Magical is really here to do, is to help a billion people.
Hello, everyone. My name is Josh Crosney. I'm the CEO and founder of the Cannabis Science Conference, which is the world's largest scientific and medical cannabis event. Thank you. Our events focus on obviously cannabis science, but also psychedelic science. I also serve on the advisory board of Saving Sophie, which is a California nonprofit organization devoted to pediatric advocacy, led by Tracy Ryan, who I'm sure many of you have heard of her before. And I also am the president of JCanna Inc., a 501c3 nonprofit devoted to the advancement of cannabis science and analytical testing and standardization. So really excited to be with you guys on this panel today. Thank you.
Thank you, everyone. Juan, I'd like to start by asking you, when it comes to guaranteeing a high success rate in terms of mental wellness, what are the key holistic pillars to building a business like yours?
Well, I think, unfortunately, in our space, there's often this psychedelic exceptionalism, where there's a sense that psychedelics are just there to do all the work. We've definitely, I always say, look, I started sitting in ceremony when I was 7 years old with my Native American mestizo grandmother. And I always say, I sat with people who were assholes before the ceremony. There might have been a week or two of afterglow, and they went back to who they were. So at least in my experience, in my life experience, these are amazing compounds to help people reboot, reset. But it's just the beginning of the conversation. You heard Leah Benson from our team, focused on integration. And we really believe that what's important here is, yes, to deliver these compounds safely, effectively, and ethically. But what's really important is all the aftercare. These compounds allow people to get unstuck, reboot, reset. But what's really important is deep integration, therapy, and everything that comes after. It's just the beginning of the journey. And so that's really the focus of our company. How can we leverage technology to accomplish that, lower the cost of existing therapies about 80%? And that's the only way we're going to be able to bring these therapies, not just to the affluent, but to veterans, to the urban poor, to Native Americans, and the people in society who are the most traumatized. So that's really the focus of what we're doing.
Josh, in that sense, do you consider that the cannabis space has really provided enough of a playing ground for underrepresented communities? And if it hasn't, how can psychedelics really level that playing field?
Yeah, no, I think that's a great question. And, with our show, we're first launching our psychedelic track for the first time in May. The plan was in 2020, but obviously, that didn't happen. Thanks, COVID. But yeah, that's really our whole, thought behind putting together the psychedelic panel is obviously the science and the research, but also lifting up and honoring the voices of the indigenous people who, this is their sacred medicine, that have been the gatekeepers of this for, centuries. Having their voices heard, I think, is more important than the science. And really, absolutely. Absolutely. And, one of the reasons why I started doing, what we do now back in 2015 was to bridge the gap between traditional science and medicine and the cannabis community to work together, not for one to take over and whatever, but for them to work together. And so we're really trying to encourage that as well for the psychedelic community. But I think, we've been in cannabis for some years now. We're just starting to teeter more into psychedelics. They're breaking down those barriers, especially, making sure people are comfortable collaborating and getting to know the science side of things. But I think that coming together as a marriage really could help advance and lift up those communities and make sure those voices continue to be heard.
Thank you. Garen, how do you consider is the best way to connect those two aspects of this developing industry, the spiritual side of things and the business side of things? And how are you doing it through your magic?
So it's a great question. I believe that life is a combination of memories, experiences, and really their intensities. And when you look at both cannabinoids and psychedelics, that's what they do, is they unlock a memory that has an elevated intensity. And so what we've found when we're in the advertising space and connecting to that customer, for us, it's always about building the community. And so really what everyone on this stage does is we're curators of a community. And there's a tremendous amount of responsibility in being a curator of a community. And the thing that you don't do, in my mind, is more important than what you do. And the thing that you don't do in this space is elevate yourself to a god or a king or a know-it-all in this space, because in reality, it's the power of the plant, not the power of the person. And that's where I think the rubber meets the road in either lane. These are totally different. Psychedelics are really about guided journeys, whether that's in a spiritual room or whether that's with psychotherapy. And cannabis is really a replacement for alcohol in a social setting. So I think connecting and messaging those two things require a tremendous amount of responsibility, and it's an epic opportunity and a responsibility to lead those communities and be someone who opens up the superhighway, like everyone on this stage has really done. Is they've created a lane for people to come in and get into that community and really love each other and share that experience and open up and connect. And when I'm looking at it, that's my responsibility. It's just simply to open the door, not really paint the room. The community paints the room. It's my job to just say, hey guys, here's a beautiful room that we can all occupy.
Patrick, speaking of building communities, from Miami, you're going to Malta very soon. Plant Week Medicine. Do you feel that the international community is more open and has been embracing psychedelics faster and with more energy than it originally did with cannabis? Or is it because of all the work that has been put into cannabis that the rest of the world seems to be more open?
I think the research has a lot to do with it, just sort of a research renaissance. But definitely you noticed it right after the cannabis industry boomed. This industry started to boom, but in terms of internationally, I mean, Jamaica has been friendly for a long time to psychedelics. Amsterdam is famous for being a place you can go and eat some truffles, in peace, and enjoy it. That was actually the first place I did it, was a decade ago in Amsterdam. So, I think they've been sort of ahead of the trend. There's whispers of legalization or decriminalization, activities in a lot of places around the world, and it kind of takes that first mover to do that work and bring access, to other countries internationally. You have to kind of, break stuff to make change, and it's with Canada coming out of, treaties, really, like breaking treaties internationally to legalize cannabis on a federal level. I think that was a big moment for the industry.
Patrick, it sounds like there's a revolution starting, and Tim and I were talking about a peaceful revolution. Perhaps you can touch upon that idea.
Well, yeah, I'm not against the FDA or the DEA per se, but if you look at these, I hear people talking at these conferences. It's like we don't really need years and years of the FDA to go through. Like with cannabis, they're trying to do single cannabinoid approvals. It's going to take years to get done. We have the right to have access freely to these medicines, of course, through setting and set, with clinics, with psychedelics going in there. Yes, many people need that, and that's very true. But for thousands of years, we've been using psychedelics and cannabis freely of our own volition, the way we want to. And there's no reason at this time, while we're supposed to be subjected to the DEA and the FDA for years and years of approval, to go through something that we know is really beneficial for humanity. And with the age of Aquarius upon us and where we're at right now, we need to integrate these into society as quickly as possible to heal humanity and heal the earth. And we just don't have the time for that. So I see that. I evangelized for Prop 64 in California, even though I knew that there was going to be these challenges. But I saw that once that happened, that cannabis would go across the country and across the world and really open it up, because California's strength, and it has. Okay, and so that's what I see right now. So I'm on both sides of the fence. I've been on the law side as an outlaw advocating for legalization, but I really think it's very, very necessary now to have a peaceful revolution across the planet so that we can integrate these and really become a free society and become the spiritual beings we're supposed to be. I mean, the evolved spiritual beings.
Josh, as part of this whole revolution that we're experiencing, what do you contribute on a daily basis, and what do you think is missing from your standpoint in the scientific realm of things?
Yeah, well, it's really interesting when you compare, the psychedelic, renaissance, I guess you could call it, to the cannabis movement. It really is taking a more clinical, research-based approach and a more medical approach, with things like assisted ketamine therapies and things like that. So I think that's really great to see. And I think that it's one of the reasons why it's moving at a much faster trajectory than we saw with cannabis. It's like, feels like we've been at this cannabis thing for a long time, and we're still, feels pretty far away from the finish line as far as, federal legalization. But I think that, there are a lot of similarities. And like Tim was saying earlier, these were, all together at one point. But, I think it's interesting because now they're trying to schedule, these 5 psychedelic substances because, like I said, we're taking a clinical approach to this. So they're really afraid because people might actually find really great information and research when they're looking at this. So I think really that's unfortunate because it's another way for the government to just try to keep people from healing themselves with natural plant supplements and other supplements. So that's my thought there.
Karen, what mistakes do you think that the cannabis industry went through that the psychedelic industry should have present and avoid?
The fastest path is definitely on the medical side. And, I think that the rec adoption may have challenged the argument, right? And it opened the door back for some of the naysayers, the gateway drug people, and that segment of society, I think, got a little bit more of a bullhorn. And especially like when you look at some of the things like the sheriffs would say, like, I told you this was going to happen with legalization when a kid ate gummies or something like that. But the reality is kids are eating Oxycontins, right? So let's be realistic in our messaging towards society. And I think that, as much as I don't think that people should go to jail for doing psychedelics recreationally, I don't know that the best path for this to become a real mental health tool is for them to be fully recreational out of the gate. Psychedelics are a different animal, and I do think that not everybody is ready for, to trip their brains out on a Saturday night. I think that, you have to be in the right mindset, and you need to be with the right friends. And, the comment earlier was, about the asshole scenario, right? Like, and it's, I've heard it so many times with alcohol, right? You give an asshole alcohol, it's just an asshole with alcohol, right? Well, the challenge is with psychedelics, when a palm tree is talking to you, right? It's a lot different experience. And if you're with, people that are not there to build you up, if they're there to break you down, I think that you've really done a disservice for your own mental health. So I think there's tremendous responsibility in looking at these molecules from a medical perspective, not arresting people for recreational use, but keeping these in a medical channel, at least for, a honeymoon period of 5 years or 7 years. I don't know what the right number is, but I feel like if we walk society through psychedelics, like a lot of us have done in our own maturity, where I can say that in the first couple times I used psychedelics, it wasn't in ceremony, and I cheated myself, and I cheated the intensity of that experience. I cheated myself on the memory that I could have created, and I really just want people to have that. I'm a very motivational and a very happy, like I'm constantly doing work on myself because I don't want any negativity in my life. And I feel that if people are approaching it from that mindset, this is limitless what it can do for the elevation of society. And I don't want to see it cut short by any amount. So I think keep it medical.
Something that I've noticed through studying cannabis from a historical perspective is that originally this plant was used as a ritual and ceremonial practices, but nowadays that element has seemed to be forgotten and lost in the reality of the industry. How do we ensure that this won't happen with psychedelics? Juan, perhaps you can talk about this, having had the original indigenous entheogen experience and now transitioning into a more tech business.
Yeah, I just wanted to actually, I'll get to that, but I wanted to circle back to what you were saying. It's such an important question. What can we learn? I mean, the reality is at the height of the drug war, in the 1990s, there was 2.2 million people arrested for drug crimes and incarcerated a year. This past year, it was 2.1 million. So, I mean, I'm a victim of the drug war. My uncle spent 10 years in jail for cannabis. I was separated from my mother because of cannabis. My brother's been in jail for cannabis. So, I mean, for me, my mom would always say that the quality of your life is in direct proportion to the quality of the questions you're willing to ask yourself. And the question I ask myself all the time is, how can it be that we started with the medicinal model in California in 2003. It's 2022, 19 years later, and we still have 2.1 million people put in a cage for cannabis, psychedelics, and other drugs. It's absolutely heartbreaking. And I think, each of us in this space has to ask ourselves, what we can do to change that. And there's people like us who are squarely, moving into the medicinal model because that's legal. We're doing a huge amount of research. We track the results of our first 650 treatment-resistant patients, and our feeling is, providing the data, maybe that's going to move the needle. Maybe there's people in this room who take inspiration by the ACT UP movement when AIDS was raging to get the government to stop its prejudice and look at the science and look for a cure. And those people who went to jail during that movement were huge pioneers and people, I greatly admire. So, for me, what's really important is, we only will be able to address this in an open-hearted and brave way if we recognize we've screwed up. I haven't done enough, and I'm a victim of the drug war. And so, I just really encourage everyone here to keep in mind that the war is raging, and it's a war on the urban poor primarily and people of color. And we all can do more. Actually, I was at a dinner with Michael Pollan shortly after he wrote a very interesting op-ed piece in the New York Times that essentially was positing the question, what do we do now that the drug war is winding down? And I told Michael Pollan, you need some more black friends, Jesus Christ. If you think the drug war is winding down, you need to get out and, stop, going to these fancy dinners and, talk to some people who are actually victims of that war, because it's not winding down. So I think these conferences are amazing. What I see going on downstairs is amazing. I don't know how I feel about it, but it is amazing. But there is a huge amount of work to be done. And I know, the people on the stage and the people in the audience, I'd love to partner with you all. Each of us has our role. Each of us has our style, but each of us can collectively, really move the needle here. And really, I want to also acknowledge your generation, because you guys, spent 40 years doing the hard work, and it's only because of, it's only because you guys were willing to go to jail and put yourselves on the line that people like us can really follow you. So really acknowledge that and thank you.
Tim, in hindsight, has it been worth the fight?
Absolutely. I never even hesitate. I've had many friends go to jail for 10, 20, 30 years. I faced 2 different stints of long terms in jail. I did get arrested 3 times. I've had my teeth kicked in. I've been through it. But every bit of it's worth it, because, and not only for me, but on behalf of all the warriors, women and men who have fought over all those years. I consider us like to be the linemen, so that people like you, all the running backs, can just run free and do their jobs and stuff. So, and I don't want anybody to get the wrong impression. People come, and we formed a thing up at my place called Ganja Boot Camp, because they thought I'd come up and smoke pot all the time. And they realized that I've been meditating for 50 years. I tell them to smoke less, pray more, meditate, and eat organic food. And so I'm not an advocate, but I got a place we've been putting on electronic psychedelic parties for the last 30 years. And I've seen so much transformation. And yes, it really is. It is, at times people can get too high. You got to be really clear about that. You got to really make sure it's all right. But overall, the 30 years, all I've seen is thousands of people leave with transformative experiences, with smiles on their faces. You go to Burning Man and check it out. Just go see what's happening. So I think we really need to open that up and bring that in. And but I do think at the same time, it's a very, very real place for setting and clinics with people going in there, that mainstream people that have a very safe place to go and have their moment and whatnot. But I'll tell you what, I love it. I'll say one quick thing, that there's a gentleman here, I don't know if he's in the audience, but he's a young, articulate black man who is the head and rolling out Hyphy Cup, which is the Oakland Mushroom Cup. And he's now doing conferences around the country. And because of what we've done, we were a bunch of basically white males who were up in the Mendocino foothills and Emerald Triangle back then, because when you went up there, you didn't really have the chance to bring people of color or many women, because it was pretty much redneck farmer or loggers, and it wasn't really a safe place to be. So that's how the business got developed. But with one of the differences between cannabis and psychedelics is now you see people like Reggie, you see people like Danielle Negrin from the San Francisco Psychedelic Society, you see Bear, who's a mycologist and a geneticist, a woman of color. And so the psychedelic industry is much more diverse, and I'm really happy to see that roll out that way. It really makes me proud to see that.
Amen.
Patrick, I guess that means that we're part of the new generation.
Yes, sir.
What is the role and responsibility of media, and especially new media, new formats, in educating and informing, communicating everything that has to do with both the cannabis and psychedelic spaces?
Yeah, I would say probably safety first. First of all, make sure it's factual, correct information that's not going to get people in trouble. No misleading statements or claims of health where it hasn't really been proven, or there's real world data sets, but you want to stay within reality, and just making sure that you're featuring a diverse set of opinions. I don't think one size fits all is necessarily the way to go. I think there's a number of paths that this is going to pursue, and exploring those equally with respect for other people's opinions is definitely an important way to go. There's a lot of polarization on media outlets internationally right now, and it's a lot of try and stoke fear, hatred, and quite frankly sell the news, because if it bleeds, it leads. So I think just having a more open-minded perception of that going forward is definitely going to help.
Garen, how does technology, or can technology enhance the psychedelic experience, or is that something that we should stay away from in the actual, during the actual ceremonies, during the actual therapies?
I think it has to be part of it. This is about the advancement of intelligence. And I think that there's many ways that you can use psychedelics for behavior modification. So for example, if you were to take, let's go back to the asshole, right? But let's go back.
He keeps pointing to me.
No, not you. No. But I think it's that person that's acting out. If you're able to have them watch another person do that type of event through a simulation, and they're able to watch that on psychedelics when they're in a happy space, and they're in the mood to connect and not cause harm, I think there's tremendous ability to reprogram and upgrade somebody's software in their mind. And that's the collision course that we're on with these metaverse type of simulations. And also, I think you can get in on people's brains and just show them how to unpack their problems, because we all have them. And the real challenge in life is, if you really want to grow, at every single moment, you have to be able to sacrifice everything you are for what you want to become. And that's the ability and the opportunity right now, is we can teach people that there is no limit in their life. When you look at true rock stars and true celebrities, and I think all of us have experienced some celebrity through this industry, and the reality is that's not happiness. Happiness is not selling a company for several $100 million. Those are all empty achievements that we put as boxes in our life. And honestly, when you hit the mountaintop, when you're at that summit, you realize that's a fake hill. And I think this is really about giving people that ability to say, all of that is garbage. It's not, that is not where happiness lies. Yes, if you have more money, you can have more fun. I don't want to discount that. But people are wired incorrectly, and that's why we're having mental health issues at an alarming rate. Money has become everything. And I really feel that the combination of technology, so that people can be at the coolest and most exquisite party, when you can sit courtside for $49 on an Oculus, you can really start to be in that world that you think is important. And once you're there, once you've achieved a little bit of celebrity, because we all, right, like it's that's an empty thing. It's awful, actually. It prevents you from connecting to people. So technology is going to be that way that takes the introvert and it teaches them to be the extrovert. It's going to be the behavior modification for the adult who just doesn't mature or get it. And I think we're living in a time that is the most amazing opportunity we've ever had. It's you can sell a virtual lamp for $49, right? It's a fake lamp. So, when you look at it, the opportunity here is endless, and psychedelics belong with technology more so than anything I can say in the medical world. I can't think of another drug that really belongs with technology more than psychedelics.
There's definitely a level of responsibility in both industries, and part of it translates towards sustainability and the environment. Josh, perhaps you can tell us a little bit about any scientific breakthroughs that you're seeing. I was surprised to read that about 3% of the total electricity in the US goes to cannabis cultivation. Are we starting to see renewable energies, and how are those going to be applied to the psychedelic industry?
Yeah, I think we're starting to see, more and more things trickle in, but it is kind of unfortunate for being a green industry, that we have such a large carbon footprint. Packaging is one thing to look at. There are technologies out there, but when you're a brand, you're going to go with the most cost-effective way to do it instead of paying twice as much for something that is recyclable. And one of the things I always hate is like you buy this little tin of gummies and it's in the tin, then it's in another bag, and then it's in another thing, and then by the time you're done, you're wasting so much there. So I mean, I've seen people that are making things out of like ocean waste, plastic, things like that. Where I'm based in Maryland, there's an organization there called the High Five Initiative that's actually sets up depositories in dispensaries so people can come back and drop off their old packaging, and then they do reuse it. But I hope that we can learn from ourselves going forward in psychedelics. But it is challenging because, like I said, at the end of the day, for most of the operators, it does come back to cost, and to be sustainable costs a little bit more, sometimes a lot more.
Thank you, everyone. I'd love to open the stage to questions from the public. If anyone has any questions for the panel. Patents on psilocybin.
That's a dangerous path. I don't agree with that at all. I don't agree with what Compass is doing. I don't agree with much of what you see out there at all, period. It's just not the way to go. It should be open source. I mean, really, in a perfect world, it'd be open source, and we just let it run. You see that in the cannabis world already. We're already having a tough enough time. Look at the cannabis world. It's already become the big boys. And nothing against them, but look, Jungle Boys, Cookies, Burner, love those guys, but it's like really already being taken over by a few giant companies, and in the psychedelic world, it's going to be the same thing if we're not, and not against them, but look at it already. You got the Marleys, you got Dr. Bronner's, you've got Burner and Cookies. They're already staking out the adult use side, and you got Compass on the pharmaceutical side. And really, people like you, Bear, are not going to stand a chance against that, because really, most of these outlaws, most of these legacy people, like you saw in cannabis, they're not the greatest at marketing, PR, finance, HR. That's not their brilliance. Was that they have passion, they do something well, they're farmers. And just like most farmers of the world, they usually get the short end of the stick.
I think part of the patent process is proving that you have a new, unique, and innovative thing. And there's a lot in Compass's patent applications that are not unique or new to them. So, there is, it's the opinion of a couple experts I know that they might not get their patents granted, which I think would probably be a good sign for the industry, probably bad for stocks short term. But long term, open up the playing field to a lot of, like this is often we're seeing it's a decently young crowd here. It's a new generation, it's a new way of thinking, and you want to give everybody a level playing field to compete on, in my opinion.
There's another question back.
That's all medicine. All right.
Tim, in that sense, you organized the Emerald Cup, and I was wondering if you envision a future in which you could do a psychedelic cup of some sort, and how would that work?
People have encouraged us for the last couple of years to look at that. Del Potter, who's one of the leading psychedelic people in the world, brought that up to me a couple of years ago. But I think if you go and follow Reggie Harris and the Hyphy Cup, I'm really proud of what they're doing. They've done a great job. We at this time, it's interesting, we have our speaker panels, and the two most sought after panels were our psychedelic panels this year on our app. So that took over all our cannabis panels. So we're going to continue. We've been integrating psychedelics. The Emerald Cup started in the very beginning. They called it, we had a joke about it was a survivor's breakfast. Anybody stayed up all night on psychedelics got a free breakfast. So that started 18 years ago. So the Emerald Cup's always been psychedelic, but just like everybody else, we had to keep it in the background. At this time, we're here to really support Reggie and what he's doing more than try to do our own cup. We're going to LA, and we're looking at really opening up the competition. Well, we're doing it across the state, but eventually across the whole country and then the whole world. And that's our focus right now. And then we'll let people like Reggie and all the rest of the psychedelic people continue on their path, and we'll support them.
I love to see the collaboration and the spirit of that versus competition. And, you guys are doing similar things, but you're like, go support him. I have my thing. I think that's awesome to see. And we can see a lot more of that in our industry. Would be great.
I think we see it a lot more often too,
Yeah.
because if you think about it, like psychedelics kind of are supposed to destroy your ego a little bit. Most people in the industry have enjoyed the medicine themselves, right? So I've experienced a lot less ego personally.
These days, microdosing is picking up as a trendy search term. I'm wondering what's your opinion about microdosing versus macrodosing, and if there's space for both.
I think microdosing is really the key. And your analogy earlier, smoke less, pray more, right? It's really the same thing. These are intended to be dietary essentials, in my opinion. When I look at cannabinoids and I look at psychedelics, they really are intended to be dietary essentials, which if you were going to take vitamins, if you have a cold, you might take more vitamin C. But if you're just trying to have sustainability, you're taking an appropriate dose day after day, or vitamin D3, right? So I think if you look at it in that perspective, it is about microdosing. And the reality that I know just from my own experience, microdosing leads me to really not want to have much cannabis. It makes me not want to have much alcohol. It makes me very easy to do intermittent fasting. And there's a lot of just key benefits that you get with the discipline of microdosing. That life is about discipline. That's all it is. Like when you look at Tom Brady or Kobe Bryant, right? Mark Zuckerberg or Elon Musk, right? These are very disciplined individuals in what they're trying to accomplish. And if you can put more discipline in your life, you're going to accomplish more. And microdosing, just by its nature, is a discipline. And then that discipline unlocks a lot of disciplines for you. So I just see it as a no-brainer. These are dietary essentials. They belong being microdosed, not macrodosed. And when you have a problem is when macrodosing makes logical sense.
And I think testing will be really important, especially in the future, because, I know some friends, they switch the batch and they take the same amount they took the day before, but then they're more of a macro because it's a different strain. Just like with cannabis, it's totally different each time you do it. So I guess like with cannabis, start low and go up slow, because if you take too much of that stuff, it's you're on that journey for a little while. There's no coming back.
I think it's great that these sort of events are happening almost on a global scale now, but it's important to remember that there's still people in jail for cannabis, for nonviolent cannabis possession, for psychedelics. Countries like Colombia, Bolivia, Mexico are really paying the price when it comes to the war on drugs. And here we are celebrating this as almost as a consumer good. What can we do and what should we do in order to really exert more pressure and help free all these prisoners and change the paradigm into a new one? This is an open question.
If our, not to get political, but I mean, if our current administration enacted some of the policies that were told to us in 2019, like decrim across the board, that would do it in one swoosh of a pen. So, I don't know that our industry is ready for federal regulation yet, because that's a whole nother panel. But decriminalized, you could open up all those jail cells, like I said, with one swoosh of a pen. So it hasn't been that long. So I'm hopeful that before the end of the term of the administration, hopefully we'll at least see decriminalization. But I think that that's what it's going to take.
I absolutely agree, and I hope that's the case. But I think as an industry and as a community, we have to stop hoping, right? And I think Alan Watts would say that reality's there until you sort of try to lean on it. And I think if anyone who's experienced with psychedelics realizes that reality is much more malleable than we often give it credit for. And so, like at our company, we just started by thinking, what kind of company we want to be, right? And so we decided it would be a public benefits corp. The whole founding team would be people of color and women, et cetera, right? And I encourage everyone in the room to sort of leave not hoping that, legislators do the right thing, because they haven't for 19 years had the been brave enough to do what everyone knows they need to do because of perverse economic incentives with private prisons and the like. But each of us can, make a difference. And that's what I think is ultimately so important.
You know what? You really should go read Annie Jacobson's book called Phenomena. She's a best-selling author, and her book was about how the CIA and the DEA knew all about psychedelics. They went down to Mexico 30 years before us. That's how they discovered and evolved with remote viewing, acid, and all of this. They knew how medicinal it was, just like the University of Mississippi that was doing all the cannabis research 20 years before the Israelis. They discovered the endocannabinoid system. They knew all this stuff. And it's unfortunate to say, but our DEA has been a criminal organization. Our FDA is a criminal organization. They go beyond Republican and Democrat. And they knew all this. And as we started having the renaissance of the 60s and 70s, they knew they had to derail that. And so what did they do? They brought in cocaine, Ollie North, and all that stuff. They brought in all the speed. They brought all the heroin in. They brought it all in, and then they built those private prisons, and they built those minimum mandatories to stifle the cannabis and the psychedelic revolution. It didn't work. Those warriors in cannabis fought for the last 40 years, and they finally have lost, and now they're backing up because they realize they're not going to win. And now psychedelics are going to take their rightful place because cannabis is a gateway herb right to psychedelics.
Thank you, Tim. A few more questions.
I thought it to myself, but
Yeah, we didn't.
Yeah.
We didn't make the panel up.
We just showed up. But it's a fair comment, and some of the other panels are more balanced. Yep. I think we're all in this together, so we all should help each other out, and it's a valid point. Thank you.
I think it's also in like action, on a company level, what you do within your company, what kind of community you build and support. We have a majority female staff now at Microdose, which I'm really proud of. We work our best to make sure that most of our event programming and all that is diversified and open to everyone, with open speaker calls and really an invitation to experts with any kind of knowledge in the industry to come join us.
And Peter and Colleen have done a wonderful job too. For most of it, it's been balanced. I know their hearts are in the right place, and look what they're doing to spearhead this movement. So my hat's off to both of them and their whole team.
Absolutely. And I'll just say really quickly to follow up as an event organizer, which I'm sure you can relate, Tim, it's also about the people that are submitting to speak. So sometimes, you have to pull from what you have. And yes, we can go out in the world and, select people and things like that. But I also encourage, people to submit themselves for these things. And, there's a whole new generation of public speakers and leaders in this room right now. So definitely put yourself forward. We would love to hear from you and hear your perspective for sure.
I want to echo that point for sure, because the data, I'll tell you guys honestly, when we put out calls for speakers and submissions, it's 70-30. It's men 70% of the time and women 30% of the time putting their hands up. So more hands, more opportunities.
Amen.
Question in the back? So we come back to the spiritual question. Juan, perhaps you want to take this?
Yeah. Well, what's interesting is, the research being done out of Johns Hopkins, which is not known as a particularly religious or mystical place. What they've realized is that you have to help patients with psilocybin, with MDMA, and with ketamine attain, have a mystical experience. One of the things I, challenged our team.
Could say magical, but
Yeah, magical, mystical.
Trademark.
Exactly. Magical place. Hilarious. Yeah, so I mean, the reality is these worlds are colliding. I mean, the only way in the medicinal model you actually get patients to reboot and reset, and begin that journey of healing is if they have a mystical experience. So, just naturally, you have to push patients often further than they'd like to go. What's interesting in the indigenous traditions, actually the doses are far less strong when Westerners are not there. I think there is something when somebody's, traveled to Colombia or Peru, and, they want to have a big experience. When you actually sit in ceremony with native people without Westerners there, the experiences are lighter in terms of the psychedelics and much more about the praying, the connection, and the community. So it's a real balance. But my point to you is, don't lose hope. There's definitely a place to talk about mysticism in the research medicinal side. And again, institutions like Johns Hopkins, Imperial College of London are bearing that out.
I want to echo the point you made about microdosing too. I found that microdosing really satisfies me. I'm really a big macrodoser, but microdosing has really satisfied me.
Child of the 60s.
Over the years. But I will say that they're really shown that when you get into a large macrodose, a hero's dose, 4.5 to 5.5, 6 grams of psilocybin, that you do have those transformational mystical experiences that really change people's lives forever in a positive way. So I think people should definitely start off slow, but when you get prepared, having a macro dose, a hero's dose is something everybody should try once too.
Yeah, baby.
I want to add to just one spot, and it kind of connects the technology thing from earlier. But quantum physics and our ability to connect. I think there's a lot of utility in being able to simulate a lost loved one and somebody who's in deep pain and needs to speak to their mom or their father or their grandfather or best friend, and having the ability to use psychedelics and use technology and reconnect them, heal the wound, give them a chance to say goodbye or I'm sorry or thank you or whatever that wound is that won't heal because there's something that they have to say to that person that they didn't get out. And I think that's right around the corner for us now.
Do you think sorry, there was another question.
Yes.
You know, I'm not a doctor or a medical expert, so I'm not even going to touch that.
Yeah, well, I'll tell you, they're finding out with cannabis, you're finding more and more women come forward and realize they're having very positive experiences using cannabis during pregnancy. And if you look at all the pharmaceutical drugs that the FDA will put into your body during your pregnancy, I myself, I'm not a woman, but I would feel very comfortable on small doses of psilocybin, working with that and microdoses and stuff myself.
I'll introduce myself.
There's
Hi.
only
Let
one.
me, let me let yeah let, yeah. I think she's alluding to the AIM, the American Indian Movement, in the 70s that was really inspired by the civil rights movement. One of their leaders, Leonard Crodog, Lakota, he just died in June. Absolutely amazing medicine man. His great grandfather was at the Battle of Wounded Knee, where 200, 300 Lakota men, women, and children were slaughtered. His great grandfather had killed a man on native lands in the 1920s and actually had his case decided by the Supreme Court. And it was the first case that gave native people in this country autonomy over themselves and self-governance on the reservation. He basically went to the Supreme Court and said, the U.S. should have no jurisdiction over me on native lands. Don't worry, my people are going to kill me, but they should be the ones that punish me. Leonard Crodog, and this is why I'm mentioning it, his great-grandson argued a case or was a witness in a case before the Supreme Court 50 plus years later in the 1970s and actually ate 113 peyote buttons as he was being questioned by the federal court. And his amazing performance actually led to the Freedom of Restoration Act, which has allowed Native American churches to work within the color of law. Unfortunately, the DEA has taken a very limited interpretation of that act and basically says that non-native people sitting in ceremony are not protected, which is an absolutely racist and prejudicial policy. But yeah, I totally agree. Native people have, led this movement for millennia, and we really have to recognize the incredible work that the Native people of the North have done. So thank you very much.
Let's clap it up for the
bringing that
native.
One last question over here.
So fungi is the future, and I fully believe that. And you know, my direct action, you know, I created the magical butter machine because people needed access to edibles, and there was no way for them to get them. It wasn't legal in many states. You know, let's go back to 2011, and I had a friend with Crohn's disease, and he was controlling the side effects of his disease by ingesting cannabinoids. But it was a sloppy process, it was inconsistent, and he had such varied results because the human input is so much. And I believe the easiest way to solve these problems is to take us out of them. And so I'm developing an at-home mushroom fruiting chamber that will allow everyone to grow their own mushrooms. And it's no different than what I gave people with edibles. No, but I got the magicals, and you know, like magical is where the magical is my space, right? Like I think there's an epic responsibility to build that brand because it's an important word. It's one of the top 10 words in the English language. So for me, it's about, you know, taking a word and giving people a lifestyle. And the reality is you have to have commercialization because that's the only path to sustainability for charity, for doing good, for deliver. Like if all you do is pay out, that's a very short path to a sustainable charitable ecosystem. You have to have revenue, you have to have profits, and you have to give back. So, you know, the quick answer for you is I'm giving people an ability to grow mushrooms at home, and I want people to grow all kinds of fungi because fungi is the future.
Thank you so much to everyone for coming. We already got the final wave. Time is up, but we'll be around if you want to continue talking to us.
Thank you. Love you guys.
all.
Great panel.
Thank you,
Great
everyone.
panel. Great panel. Love you guys.
Hey, brother, great job. Thanks for doing Hey, get in the middle. Everyone say mushroom.
It's on, man. Yeah. No, no.
I get you guys.
Yes, yes. Early this morning, Yeah. No, I love that. Wow. You really got yourself good. You don't want me off the set. You did great.
It's 421. Hey, everybody, please welcome Rohan Marley.
Blessed love.
And Douglas Gordon.
And Rastafari. Always welcome Rastafari.
I'd like to begin by saying that tomorrow is Bob Marley's birthday. Tomorrow is Bob Marley Day.
Yeah, every day is Bob Marley Day for me. So.
He's a son. He can do that. But for us,
yeah,
we celebrate every year on February 6th to remember the great legend Bob Marley. And we do it here in Miami. Many years I've been coming to Miami for the Bob Marley Festival when I worked for High Times, and we would come and they'd have a festival at Bayfront Park, and all the brothers would play. And I've been coming many years for that. They haven't done it as much in the last few years, and I'm no longer working with High Times, but during those years, it was a lot of fun. And I feel like it's come back around for me to come back to Miami on the Bob Marley weekend of all the days, and especially it happened this way, a good weekend, you know, Friday and Saturday and Sunday, not in the middle of the week, where we can really celebrate it together. And so here we are today celebrating Bob Marley's birthday tomorrow, and having a really fun discussion with Rohan and Douglas about what they're doing in the psychedelic world. Rohan and his family are really associated with ganja and cannabis when it comes to the plant that we like to consume. But this is another level. This is another level.
Stevie say ganja, I say herbs. What you saying? What you saying, brother? Can you hear us? Okay. Yeah, well, we say herbs.
So where did the ganja come from? You don't say the word ganja?
Well, yeah, I mean at times, but we want to say herbs at this time.
All right, and I'm going to say herbs from this time point on in this conversation. No more ganja.
No, feel free. No, feel free.
Okay, then I'm going to say both.
And I say what I say.
Herbs and ganja, and cannabis and pot, and marijuana,
anything,
and reefer. So,
and
so you know, just so people know, you know, Bob Marley had a lot of children, and Rohan is one of them.
Yes, we have 11. Is 11 of us.
Right. He's the fourth born son, and he was born after Ziggy, Stephen, and Robbie. Correct. Right. People must know him in Miami for his football playing career. He played for the University of Miami, the Canes. And he went on to play professionally for the Ottawa Rough Riders in the CFL.
Yeah, they didn't let me in the NFL for some odd reason.
Did you ever try out?
I know I did.
Did you ever get an NFL tryout?
I was ineligible.
Ineligible. Too much herbs.
No. What happened, honestly, my son was born in Haiti January 5th. We had the Orange Bowl on January 2nd. I went to Haiti to have, the birth of my son. And in Haiti, there's no phone. So I couldn't call the school to tell them I didn't want to play my senior year because I didn't feel like it. I wanted to leave, but I was too late. So they told me no exceptions to the rule. So after that, I said, okay, brothers, I'm done with football, on the road.
And you saved your body, too, doing that in the process, so you don't have to worry too much from all the hitting and stuff that happened back in those days. Do you have any problems due to that?
I mean, not from that, but from just
concussions, anything like that?
No, I don't think
No?
so,
Never
because I
had?
smoke a lot of herbs. So,
So that is the protector for the concussion. That's great.
Yeah.
So also you have many children. You have a new grandchild, I understand.
I have 12. How much? 11 children. I have one going to be born soon, and I have 4 grandchildren. Yeah, you have to be fruitful.
Also famously associated with the great singer Lauryn Hill.
Yeah, a beautiful woman, a queen.
Co-founder of Marley Coffee.
Founder
of, okay. Roe Marley Beach House.
Yes.
Lion's Order.
Lion Order is the way we live and how we see life.
He works with the Bob Marley Charitable Foundation.
Since day one.
And we're really here to discuss Marley One.
Yes, and that's why Douglas is sitting there.
Right. So Marley One is a brand in Jamaica that is what they call functional mushrooms.
Right.
And we're going to talk about that a little bit. I don't know that much about it. I know the names, turkey tail and what are some of the names?
Cordyceps chaga, but it's
right,
not just
lion's
Jamaica.
mane and all that. You're right. So
But it's not just Jamaica. We're all over.
Those are the function. That's the, you know, my family. We have two sides. You know, we have the functional side, and we have the dysfunctional side.
I thought the other side was the psilocybin side.
Exactly.
All right. So you know, when this story broke, that you were Marley family was partnering with Silo Wellness to do a brand of functional mushrooms in Jamaica. I read the article, and Rita said, when Bob and I were young, we followed a strict natural diet, and we would include medicinal mushrooms. Mushrooms fit into with our vision of a world transformed for good through natural products. So how would you explain that? Was it Bob using psilocybin?
You want me to speak?
Yes, please.
Okay.
Well, in this particular case, directed to
Being that
regarding Bob.
is Marley one, we're gonna let Douglas open up.
Okay.
Go ahead, Douglas, and then
I just wanted to just one thing on that.
You want me to say something?
Yeah, just answer that, which is,
Okay,
I'm just
fine,
curious
fine.
whether
Wait,
Bob was.
I'm going to tell you, being that I wasn't there presently, but being that I have been present there in my own presence within that realm, I would say yes.
Well, they were the only mushrooms that people probably would have used for the transformation. I mean,
Yeah.
Sedella says.
Wait 1 second.
Okay.
Being the way my father see life and the way he lives life, I feel like the plant medicine was something that he would more go towards. So I am like that.
Right. So Sedella, his sister, who's part of this company, the Marley One, she said, these are transformative times in which we are living. Our family seeks to use our platform to help facilitate positive change. Mushrooms have been used for centuries, and we believe they offer a natural pathway for healing and positivity. It's our wish that these products will empower people to experience oneness with nature and the universe at large, and ultimately achieve greater self-actualization. That's a lot there. Would you like to sort of explain a little bit more in terms of your relationship with
Let me say
Sedella?
something, then you talk a little bit. That's a lot, but I mean, it's life, you know, and it's aspiration. And whenever we do things, there's a reason for doing things, you know. We don't do things with just one way. You know, we think about a journey of life. So understanding plant medicine and, you know, the both sides to mushroom, which is what Marley One is, that is some of the reasons. And it's not that it's a lot, but it's what the plant does. It's research and studied. So we're just like what do you say, echoing the reality. And then Douglas.
Yeah, I think, you know, for us, it's looking at also lessons from cannabis, right? The industry, how it evolved, and some of the challenges it's experienced over its time. And what you see is we had an opportunity with partnering with the Marley family, with Marley One, which was to start to destigmatize the whole idea of what mushrooms represented. You know, what psychedelic mushrooms represented. You know, there's 3 types of mushrooms, as we know: culinary, there's therapeutic or functional, and then you have psychedelic. And it's very important that we understand that the functional mushrooms in of themselves have tremendous health benefits, you know, akin to different herbs and so forth, but they in of themselves are good for us in our wellness journey. Psychedelics are extremely powerful for us in our mental transformative journey. So there's different stages to it. And what we've embarked on is using this partnership as a means to destigmatizing, broadening people's education around what mushrooms can do, so that they're in a better position to, instead of, as we go along the path sometimes now, we say, oh, I'm in psychedelics. So, wow, that's crazy. But, you know, that's just a knee-jerk reaction because they don't understand. Over time, what we see has already happened and will happen more is people become more understanding of how these have health properties, and therefore more open to understanding what the mental health benefits are. And I think in what Sedella was saying, it's a recognition of the totality of what mushrooms bring to the table from a holistic perspective. And I'll just tell you, you know, personally, in my life, I always associated Bob Marley's One Love as being people understanding people, people being, you know, tolerant and understanding of each other, whether you're from Trinidad, Jamaica, you're black, you're white, you're green, what have you. And what I've realized is it goes beyond that. It's really us understanding that as an earth, as a planet, you know, we all have vibrations that interact with one another.
And so the one love motion ideal that we're seeing through this whole mushroom journey is much more than us getting to understand each other. It's us understanding that we are just part of a much bigger ecosystem, and it will benefit us, but we also have a role to play in how it also, you know, works and operates and thrives and benefits us all as people. So it's a wonderful opportunity for us to partner with a brand, yes, and I say that very deliberately here because that's what it is to some people. But also have this wonderful opportunity because of what Bob Marley has stood for, and with really great admiration for what his children have done in sort of continuing his legacy, which is not just to say let's look for commercial opportunities to benefit and leverage, but we're also only going to do things that we believe in. We're also going to only do things that we think are right, that are true, that are authentic. And so, you know, we feel very honored to be a part of that whole journey, if you will, of bringing this to the market in a way that we think is very representative of the values that Bob Marley espoused and stood for. Yeah.
And what are the therapeutic benefits of functional mushrooms?
They're different. So, for example, you know, we have 5 SKUs at the moment. One love, sorry, one flow, one mind, one body, one harmony, and it'll come to me. But, you know, for example, and this is, again, I think it goes in many ways to, if you're doing things for the right reasons, you get outcomes that sometimes are way beyond your expectation. And that's what we've seen with the functional mushroom line. We have people who use one mind and will tell me, you know, they've been diagnosed as ADHD, they've had, you know, different sorts of challenges, whether clinically diagnosed or just in their own ability to focus over time, who take one mind and then they come back and say their friends are asking them what they're taking because they're so much more focused. They themselves, even folks who do not have that clinical diagnosis, excuse me. And it's funny, Rohan, but your sister Cedella, I mean, yes, it might be convenient to say, oh, all the Marleys think this is great product, right? But we're talking about what's real.
She loves it.
Cedella will tell you that, Cedella will tell you that we cannot make a stronger dose of one mind because she doesn't know what she would do with the additional creative ideas that it's unlocked for her. You know, we've had people who take one harmony and they've come back and said, I used to have IBS. I don't have it anymore. You know, I mean, yeah, you say, wow. And I mean, I hear that and I have a responsible role to play as a CEO of a publicly traded company, which is not to run out and say, it treats IBS, because I'll get into trouble with that. But the benefit of it is in putting these products into the market. And I think, again, coming from a place of truly trying to help and heal people, we're seeing outcomes. The efficacy is so much beyond what we anticipated. And it's in many ways, not to sound woo-saw, but I think it's in many ways because we're taking the right approach for the right reasons, and we're getting outcomes that are beyond what we anticipated. But on a health benefit perspective, no psychedelic psilocybin is not legal in most jurisdictions, but functional mushrooms are. And beyond the business idea of desensitizing folks and making them more open to learning about mushrooms, we have seen that we have this amazing opportunity to help people live more fulsome lives with better health. And that's a truly fulfilling journey for us.
Where are Marley One products available? Only in Jamaica or in the U.S. as well?
No, in the U.S. we've just recently struck a distribution deal that will put us into 3,700 outlets. And we just added another 1,400 outlets. We've just signed a deal. Thank you. It's been a real struggle. I'll tell you, it's not been easy. But you know, we've just landed distribution in the UK. We've just done a partnership. We're going to be in one of the most well-known, well-respected retail channels in the UK. So it's just taking off now, and it's a beautiful thing to see it all come together.
Rohan, what's your experience with these functional mushrooms? How does it work for you?
Well, like I told you about my family, I have 2 sides. I have the functional side and the dysfunctional side.
Which one are you?
I'm more the dysfunctional side. So yeah, for me, you know, with the entire whole plant medicines from you know, herbs to, you know, mushroom, I feel like everything that we have been living through since the creation. We've depended upon man, and it comes a time, I'm going to be 50 this year. So it comes a time when I want to be like, you know what? I'm going to try something else. I've been listening to everybody tell me, oh, this is that, and the third, But now I want to try what God created, which are these, the fungi, as we call it, the plant system, the whole plant life, because when you get to a certain state where your mind becomes into this higher place and higher thinking, you start to want to receive messaging. And when you talk about messaging, we're not just talking about messaging from you and I or people, but the entire universe, the entire liberty of this universe. So as we know, the sun, the breeze, the moon, the stars, the rain, that's the blood of the earth. It has all these messages. So the messages, though, it comes through the plant life, right? So, but the only way to really get the messaging, you have to take the plant system. You have to indulge. You have to want to know. So for myself, as I call myself one of the dysfunctional ones, I like to go on the psilocybin side because, our Marley One is not that. Our Marley One is strictly functional. And yes, I love it.
For now.
Yeah. And I love that because it's healing and helping. It's a part of the plant medicine movement that's happening today. But I am very much into the psilocybin side of the world and the psilocybin type of thinking and way of life. And just the plant itself or the fungi itself, it not only healed me, healed my own mind and my soul, but I believe that it's good for mankind to be awakened to the whole plant medicine movement. And herb is one, such as what we're talking about today.
That's a beautiful statement.
Thank you.
You were teasing that perhaps the line will go to psilocybin. I mean, what's the plan for Marley One overall?
No, not teasing. That's absolutely part of the
Yeah,
plan.
but we as a family, we're not just wild in the bushes. We actually do things that are, go by the laws, and we abide by the way, such and such. So we will get into that space when, the government of the world decide that this medicine should be legal and available to everyone. And we will venture that space. But for now, we're going to deal with it like we dealt with herb all our lives. We're going to take it when we want, when we feel like it, and no one's going to stop us from doing that.
And so, what is the status in Jamaica? How far away? I mean, there have been some laws passed in the U.S., mostly on the local level, but also, Oregon, state that you work in, where there's psilocybin therapy now. How far away is that for Jamaica?
So in Jamaica, we have, in our pipeline, actually, microdose and other stronger psilocybin-based products that we're looking at. In terms of when we bring them to market, it's not illegal in Jamaica, and that's a terminology you have to use because there's no law that says it is legal, but there's no law that says it's not illegal, not legal. Sorry. So we are able to do it. We're on the cusp of opening up a smart shop, which will sell a lot of different mushroom products in Jamaica. And in terms of when we roll out Marley One or our Marley branded microdose products, that's really just a function of looking at the marketplace and determining when will serve us best to do that. But a big part of this process, both from us as an entity, myself as an individual, and working with all the different elements of the family, is really about how do we educate people properly? How do we really get them in that space? A lot of times when we talk about psychedelic journeys, it's set and setting. And, sometimes it's unfortunate we shorten mindset to set, because it's very, very important that we put a little bit more emphasis, I think, on mindset and really making sure people understand that it's getting comfortable. It's understanding what you want out of the process. And in understanding what you're trying to get out of it, you're better able to sort of navigate the ups and downs that might come in that initial part of your journey. So it's not a quote unquote bad trip. It's a process, because you understand what the end game is. So, we're working through all of that. But as I said, it's just, educating as much as we can. And a big part of education is, getting people comfortable with the idea of exploring their own and forming their own questions. And that's the path we're on right now.
Is psilocybin is something that's is it different in Jamaica as far as psilocybin we find in the U.S. or psilocybin is the same anywhere?
No, I mean the fungi has different species.
It's carrots. It's carrots different in America. I'm joking.
Well, actually, they are because they all look the same in the supermarket, and I don't understand how they do that.
You have a point there.
So I think I trust the ones in the Caribbean more
Well,
than
it's
the
kind of
ones
like we
up there.
talk about strains of cannabis. Are there like different strains of psilocybin? It's different.
Yeah,
like
they're
what,
called
you,
species.
what you would find in
Absolutely.
Oregon would be different what you find in Jamaica.
They're called species, a different species of the
Right.
fungi. Yeah, but in terms of whether a particular species here is different or the same as Jamaica, I don't know too much about that. I can't really speak that that's a material difference. I do know that in terms of access, what you have in Jamaica is the ability to have it legal and to have it in a therapeutic manner, as distinct from something that's less structured, which doesn't necessarily mean it's bad. But I think in the first instance, for a person who's really searching and understanding and not experienced, it's very important.
You're also involved with wellness retreats, and that's sort of a new thing. Ketamine treatments. I think you're involved with that as well as psilocybin. So tell us a little bit about these retreats. What are they about? How do they work?
Yeah, so we started having our retreats.
That's different than Marley One, though.
No, it's our psilocybin, correct?
Oh,
yeah.
yeah,
But
okay.
it's psilocybin retreats in Jamaica.
Oh, okay. Same. No, I was talking about the ketamine side.
So yeah, ketamine. No, we don't have any
Right.
with you guys yet.
Right, I'm aware of that. Ketamine has nothing to do with Marley One.
Yeah, but so our retreats, again, it's very holistic. We take this approach to say, really come and get your mind, body, and soul attended to. With a sense of where you're trying to go in your life, because I like to say that psilocybin allows people to become who they are. It allows them to sort of step away from all these different social constructs and their own these fears that they've sort of accumulated over time, as well as to reinterpret their traumas. Yeah.
Facts. I'm what you gonna call me? I'm a guinea lion of that.
A guinea lion. I like that.
I don't eat pigs.
You should trademark that one. Yeah. But
it's free.
Lovely. And that's important too, because it is about open source. It is about sort of like helping people to get on this path. But what our retreats are, they're 12 to 15 people at most at a time, because that's a maximum group size before group dynamics start to become problematic potentially. But we take them through a spiritual journey, meditation, yoga, sound healing. The foods are all carefully selected and cultivated. The destinations we use, again, it's you can give this therapy, but if people are running back to their room in a big all-inclusive with all these different distractions, it sort of undermines experience. So all of these things we take into account to really afford people an opportunity to truly just expand where they're trying to go. And you have a couple of different situations. You have some folks who are really trying to process trauma, and really have challenging things that they're trying to navigate. But here's the interesting thing that we can't lose sight of. We all have trauma. That's the reality. We all have trauma. So whether you're clinically diagnosed with different challenges or not, what these journeys allow you to do, what this retreat allows you to do, is really to reinterpret some of those traumas that have held you back and allow you to expand into, as I said before, being the best version of who you are. That's really what it is. It's not sitting across from someone else and trying to be, oh my God, I could be better than them, or I could be just as good as them. It's really being able to sit and be
ego.
100%. 100%. And we have seen people come on our retreats, and I mentioned before, like, being the CEO of a publicly traded company when you've lived your life in the private sector, non-public, is a very different animal. But there's nothing more rewarding to me than when I can play back in my mind some of the stories we've had from some of our clients. We've had a couple who, when it's a terrible place, the night of arrival, I remember the story. The night of arrival, they had a big fight. Why? Because, the wife went to the shower and she called to the husband to sort of like pass a towel. And he's upset because, like, again, why don't you're so selfish. You don't, you're like, wow. And yet in the middle of their first journey, the ceremony, he gets up and walks across to her, because we had to separate them. That's how bad it was. to say, you know what, I can't believe how much I realize now you love me and what you've put up with. And I've been, all of these things that he came to a realization with. And on that same trip, the man picked up the phone and called his children, 21 and 19. I've told this story before, so maybe I got the ages wrong. It's not the point. To tell them for the first time in their lives that he loved them. You know what I mean? And so again, we're all this process of life and our experiences, and may not be clinically sort of diagnosed with anything, but we have our trauma. Could you imagine being a person who had never told your children at the age, who lived with him? It's not like they were separated or anything. Like, he'd never loved them. This man has brought his whole family to Jamaica several times just because he's so connected with that experience. So we have stories upon stories upon stories like that. My challenge is, how do we scale this business so we can help more people? Not just how we can make more money, it's how do we help more people? Because that's the essence of what you want people to really aspire to and live.
That's just great. What I find really interesting, I want to ask you, Douglas, is that I read your background. You were Bank of America, and you're now Silo Wellness with whatever stops in between. It's kind of been a long, strange trip, as you'd say. How did you get from that point to here?
I'm not sure, but I think I've tried to pursue things at every turn made sense to me, that could really, not from some sort of like benevolent perspective solely, but only things that I thought were important to do and were real and authentic and really help people. I started a cannabis conference, and that was the principle of it. Like, Jamaica was going to lose an opportunity, in my perspective, if we didn't elevate the conversation, so it was global. But Cannex, yeah. But and that's what drives me with this business. It's that we have this fabulous opportunity to help people. I consider it a very welcome but important obligation to just find ways to facilitate the healing, or our people, allowing people to come and have this exchange. One of the things that I think that this industry is so nascent, has to really be very honest about, is unfortunately a lot of people have taken on this idea that the healing of the medicine is something that they have been directly responsible for. And that's absolute nonsense. The medicine is healing people. The medicine provides that pathway. Those of us in a position to facilitate that are fortunate and blessed. And as long as we recognize that and really give the homage to the medicine, that's how we stay grounded, and that's how we stay really living in the fortunate times that we are in now, to say that there's a healing property right here in the earth that can benefit the people of the earth. And it's, that humility is so important, because, I think it was yourself or Rohan used ego death, or the, being without ego. And it's a catchphrase we use a lot in this industry, but it's not really used to be honest. It's used as a sort of representation of, I'm not that, when that's exactly what that person really is. And as long as we can be honest about that, I think we have a pathway to really doing what this medicine is allowing us to do, and that is to heal people, help people, get all these folks, thank you, get all these folks who are social media in of itself is not a bad thing. What it has done by making people anxious and trying to be what they're not, and walk into a room and they think everybody's talking about them, that's the problem. And if you can get more of those people walking into the room and being like, I'm happy to be in this room, or I'm not happy to be in this room, but it's a function of what I think about being in this room, not what these people in this room think about me, I think we'll go a long way to healing a lot of the harm that we're presently trying to navigate.
Rohan, would you like to say anything else about Marley One? We're going to take a couple of questions, but any sort of last statement to leave with people about that?
I'll never have a last statement, but
well, for now.
Well, I'm just joking. I like to be funny.
I know, it's okay.
I like to tell jokes. Anyway, for Marley One, we're truly excited about the endeavor. As entrepreneurs in the family, and we have children, we have lives. We create something that is accessible to all human beings, and we're truly happy and we're excited about the growth. And I'm excited to learn more about the functional side from Douglas, because I'm all the way over the other side. So yes, we're truly excited and happy, and You know, that we feel like more people in this universe should lead towards plant medicine because it's the best way to go, especially in these times that we're facing now. We gotta, we gotta find remedies, and you gotta like, yeah, I have something to say. You gotta believe in yourself, and you gotta believe in your soul, and you gotta feel it. Sometimes, like, I have a little story because Douglas told a long story there, so I gotta tell a little story. Right. So what I was gonna say is like I look at my daughter, right? That little daughter, I have a couple of them, but this little one. And every time she goes like this, oh, something hurts, her mother always thinks about the hospital. So, but even myself, I'm like, okay, if my foot hurt, I go there. But the doctor, he sits there and he tells me, oh, this looks like that. This looks like that. So he doesn't even know what it is. But he says, you know what, this does that, which is like, if it's an infection, they have all these different drugs that's for the same thing. The doctor never does anything besides he gets a little notepad and he writes on this little thing and he sends it to the pharmacy. So I said, Jano, you mean to tell me they want me to live my life like this? I got to go to this guy, for this guy to send me to this guy to give me something that this other guy made? That's too many guys. I don't want to live like that. I mean, I'm a man, meaning like I have my own thoughts and ideas. Like if I'm thirsty, I drink water. No one tells me, "Oh, you should drink this water or that water." No, I figure out which water I want to drink. So that's life. So, but I want to live. I don't want to depend on what you say for me to live. I don't care how much studies you have done or anyone has done. I want to live because it's what I'm learning. And, when I do this, oh, I feel this way. Yeah, so I'm going to keep on doing this to feel that way. And one thing I know for sure is that human beings can heal themselves, because that's just how it's in existence. And the healing comes from the blood flow, right? So you got to make your blood move. You got to bring oxygen into the body and move things around because that's the blockage. So I figured that out. So for what you talk about Marley One is about oneness, one universe, one healing, one medicine. I mean, not one medicine, but just a term. But many medicines then, many plant medicine. So we want to be a part of that movement that's gearing towards where this world is going because now we're in a pharmaceutical warfare. It's not even like, trust me, it's not even like what it was before. It's definitely, you can't go to school if you don't have this from this guy, the same guys. So anyway, that was my little wording.
Marley, one love.
Rastafari love.
Any questions? Right over there with the hat.
Yes, brother. Yeah, well, okay. So in this world, business is business in regards to whether it's public or private. Business is operation, and it doesn't matter who's in charge. It could be a red man, black man, blue man, green man, any man, but it just happens to be this man, which is a black man, as we call him, but we call him an African. So it just happens to be that that's his portfolio. That's what he has been developing. That's his life. That's his aspiration. That's what he wants to do. Just like Tom, Joe, and Harry wants to create that. So it doesn't matter if you're publicly traded or a private entity. It's the way of life. It's how you do things because, I mean, I'm sure everyone's all into this Bitcoin stuff. That's all trade and public trade, blah blah blah. So it's just another system of economics. You know what I mean? Some people utilize that public vehicle to raise capital to help them to grow their business. You know what I mean? So we don't look into that stuff. That's not my problem. That's for Douglas to deal with. You dig? Our situation is doing what we love to do, create new products and new entities. However, Douglas wants to raise his capital to get that moving in a truthful way, the way that the SEC says to do it. Because I myself had a public company when I started Monday Coffee, because it's the only way I could raise any capital. The guy said, "Hey, listen, if you start this company, I'll put $2 million in, and you get it in tranches. But I know if you give me shares, I'll get my money back." Blah blah blah. So those are the situations in the business world. You know what I mean? But that's not our problem. You think our life is how we live it, and it's a way of life that we've been living since day one, and we get that from our father. I get that from my brothers and sisters, and truly, we get that from Haile Selassie the first, the king, and all that great things. You know, so it's more about it's really more about the human being and the person. You know, so if this being, as he is, a good man, you know, a good human being, obviously, the thing that he does is going to be as he is. So we believe upon that, we live upon that, and we cherish that, because you have to work with someone. You dig? You can't just do it yourself. No man's an island, you know. So we choose Douglas.
Douglas, what's your thoughts on that question?
I appreciate that, Rohan. But I think from our perspective, what we've looked at is, you know, we make a point of working with the indigenous communities. Okay, and why? It's not because it's a really cool thing to say and do. It's because the understanding the history of psychedelics has been because of the use in the indigenous communities for thousands of years. They've made us understand, and it actually posed a really interesting situation for us, because, you know, we have this worry in the Western world of, we need these trials, we need this, we need that, and then it's okay, right? And people who don't follow that path, they don't know what they're doing. That's some bush doctor bullshit, and it doesn't work, right? And yet we say, but hold on, if we do this way, isn't that where opioids come from? Isn't that the same system that tells me I need a prescription for 800 milligrams of ibuprofen, but I can go buy a package of 36 of 200 milligrams in the pharmacy? So tell me how that makes sense, right? It's the same system. So we actually have this opportunity to ask ourselves, if we could learn and be more open to understanding that the indigenous communities, there's a method to their madness, so to speak, that we can learn from instead of just pushing to the side, right? We give that some more respect and regard. I think it can benefit us all on both sides, because Western medicine has to also appreciate the fact that it's not because of studies in 1957 and studies that were restarted in 1995 that all of a sudden psychedelics are okay. There are people who've known they've been okay for thousands of years. We've just decided that because he said it or she said it and he didn't say it, then it doesn't really matter. And we have to learn from that, because at the end of the day, how do we improve ourselves as humankind for the next generation, the one after that, the one after that? And this is a learning opportunity for us. Us as an enterprise, what I can say to you is, without judgment, I've seen companies come into the cannabis space in Jamaica. I've seen them float in. They do two little things. They make a public announcement. Their stock price jumps up $50 million, and they're out. Okay? I've seen it with psychedelics. And so what I looked at is, okay, to Rohan's point, that's your model, that's your model. I'm not here to judge it. But if I'm going to be involved, I want to make sure that the day that it does not make sense for Silo Wellness to operate in Jamaica, I'm not going to fight that because it doesn't make sense. If it does not make sense for our business, it does not make sense for our business. But if there are people that I can help in the process to learn, to develop expertise, so that they can go and take that expertise that they have had with working with us and channel it into other aspects of psychedelics, that they can have a global opportunity, then that's what I'm going to do. I'm going to make sure that where I saw with other retreats, I call it a helicopter. They helicopter everything in from the States and drop it in Jamaica. Then after the retreats, they helicopter and it's out. You're missing the essence of Jamaica. Jamaica is not just a place. Jamaica has a magic. Okay, Jamaica has a history. And if we can now give people an experience that says, hold on a minute. First of all, there's no compromise on the caliber of the people administering the retreat. That's non-negotiable for me. But we can go on a search to find out whether there are people here who either have the skill set or capable of developing the skill set who can then lead our retreats. And just by taking that approach, we found someone who I knew from Canex, okay, head of the Rastafarian Indigenous Village, and he's the person who's been leading our retreats. So we have no issues in terms of skill set, but we also have a person who, as we learn and we grow, is learning and growing about psychedelics. He's getting more people involved locally in psychedelics. And so now there's this whole base of people who are developing expertise and applying some of these traditional indigenous knowledge to serve and help people today. And where that leads in the future, who knows? But I can put my head down on a pillow and say we're taking the right business decisions anchored in an authentic outcome that is serving people across the spectrum.
When's
That's the most I can-
when's your next retreat? Sorry to jump in there, but when's your next retreat?
March.
Where?
March of this year.
In Jamaica?
In Jamaica, yeah.
Sign up.
And that's actually what we've done with our retreats is we've themed them out so we can get people like-minded to come together. So our next retreat is actually a woman-based retreat, woman-focused. And again, how do you do it in a way that's real? You talk, oh, let's do a women's retreat. Great idea, Douglas. Great, that's good. And then you talk to the people. Well, who's going to lead the retreat? Oh, first man. No. That's not going to work. You got to have a female leading the retreat. Really? Okay, so let's go look for a female retreat leader. And we've done that. So, it's about having that thing all the way through. That is not a one-man idea. It's about having a team that's able to say, you're wrong on that. You've overlooked this and you've overlooked that. And we build it out that way.
Look, women over there like to speak.
Wow, that's fantastic. Beautiful. Yes, thank you. And that's the reason why we do the things we do, because we like to partake in the things that is a part of our daily lives, and we like to share that. And if we can make it into something where it can benefit, the generation to come and so on, and they can keep that movement going, just like the music, because the music is not it's not a plaything, it's a music. There's music and there's music business. Just like anything else, like the clothes you wear, there's a business that provides you that clothing, the food you eat, the car you drive, the gas you pump into, everything. There's an entity that provides that. It's not like you just walk outside and pick a mango off the tree and you eat. No, it's not like that anymore. You have to go to Whole Foods, or because if you want mango, you have to go and someone's gonna farm it, and you know what I mean, because it's just a way, like it's just trading what you have, but then now we have the paper system and the dollar system that you trade with. So it's life, it's what suffices life. So it's part of the journey. But the most important thing is the mind state, because all those things are from the physical realm, right? But when you get into us, the Marley family, what we bring to this physical realm is a spirituality, right? So, because we know that man is the greatest, right? Man, woman. When I say man, I mean all of I and I. Man, woman, man and woman, human beings. We know that we're the greatest, and we're of the Creator. So the magic is really the soul, and the mind, and how we feel each day, and we wake up and we give thanks. So the ethos of I's family, the Marley family, is that, So, and we know that because that's what we are. That's the mission, So when we present you something, it's more than the physical intake. It's about the essence, where it comes from, and the people, and who they are, and what they represent, and what is their purpose in life. So that's why we do the things that we do, and obviously the business side of it, So yeah, like everything else.
So while we're here to speak about Marley One, I do want to give a shout out to Marley Natural,
You
which
have
is a
to.
great brand.
True.
I have a question right there.
9 years ago, I got a phone call from my sister-in-law, and I was able to purchase an acre in Jamaica in my wife's ancestral home, and I captured that land back from a white widow in Wisconsin. Okay, now I would like to do something like that. I've already in 2015 I grew my first 5 cannabis plants with my son, my Gen Reed son, and now I just want to move forward, and I want to, I'm getting older, and I want to do that. So I'm really excited about what's happening in Jamaica still. I haven't lost heart, even though the cannabis thing has been really iffy, but I can still decide to maybe the key.
True. We have to just work with a good person that understands the mechanism of the country and how to operate on business side, because obviously the country, they have their agriculture department, certain things, unless you're just going to be a mom and pop guy, that you grow your shrooms there, and then you build a shop outside of your entity, outside of your land. Huh? I don't know if that's true because they drink rum down there. No, I'm kidding. No, but what I mean is you have to just partner with the right people that has because it's no different than any other agriculture. You need permits and such and grow in a certain way, because if people are taking it, they have like America, they have their FDA. Jamaica have their trade rules and stuff. So it's nice when you can meet Douglas, and it's like you become a co-op, co-op type opportunity, where you say, hey man, I have this down here, you buy me this, and you say, okay, I'll give you this price and such, and you follow his regulations and you do that. But it's how we, huh? Yeah, man. So you speak to him afterwards, you get his number and stuff.
All right, we'll take a few more. Anybody in the back, way back there? You got to speak up.
How was Jamaica in May? The same as it is today.
What do you mean by that? Anyway, you gonna visit?
The weather.
I know you're planning to visit.
Yeah, go down there, man, and especially May is a good time.
We actually have a retreat in May as well.
Yeah, May is a good time, man. Go to Jamaica in May, and may you have a good time in May in Jamaica, and maybe I'm there with you in May. So May is good.
Maybe I'm amazed. What? Who else? Anybody else? We're done. All right, right there.
Lucky guy.
But I'm wondering, and I know a lot of people have a lot of different
focus for, say, synthesized psilocin or psilocybin in the retreats, and not necessarily changing the retreats they are, but the same therapeutic ritual that you have, but a different, more standardized.
It's tough. That's tough.
Somebody had to bring it up, right?
That it's look, it is tough, but so fundamentally, what psilocybin has done, what psychedelics have shown us, is that we have a pathway to help people, okay, and that we didn't know was there before. We have a pharmaceutical industry, which I'm not here to sort of lambast them, but we have a pharmaceutical industry where 30% of the people who are being treated by drugs for mental illness, they accept don't work. Okay. Now, when I hear those statistics and I think about, well, hold on a minute, I know people who take some of those drugs, and if they're in the 70% for whom it works, Jesus Christ, help us with the 30%. Okay, because you have people who have to make a choice as to whether they're going to be zombie-like or they're going to run the risk of having a clinical episode if they don't take their drugs. So if that's success, then that's also a faulty narrative, right? But then it comes down to, how do we ensure that we can replicate and serve a vast number of people with the same product time over time? Okay, that's where synthesized that's the argument for having a synthetic, in my opinion, okay, when it applies to psilocybin and other psychedelics. So it's a conundrum, but at the same token, I think we lose sight of again, we come back into two buckets. The Western way of doing it says it has to be the same every single time for us to be able to recommend it. The traditional sense, where we're now leaning towards saying, oh, okay, can you tell me how that worked? Because we said it didn't work before. Now we understand it does work. We need to find a way of understanding what the range is that's acceptable, instead of having some precise notion that it has to be the same thing every single time for it to be acceptable. We need to say it's going to be a natural product, in my opinion, that we have an acceptable range, meaning it can be grown, it can be cultivated, and we can accept within this range it's fit for human consumption on a wide scale.
And
that's a solution, not, in my opinion, not this idea that we're going to invent some lab, extract some elements, and replicate that, and all of a sudden that's okay. I think that's horseshit.
And that speaks on sustainability and community development. You know what I mean? Because if we're creating stuff in a lab, there's no jobs for like farmers and so on, you know? So it's a part of the generational situation we talk about, you know what I mean? So that's why we stick to like the original way, because it's a longer chain, you know? That way you have this guy is farming, he got to feed his family, put his kids in school and so on, you know? No chance.
All right, everybody, let's hear a big applause for Rowan Marley and Douglas Gordon. Thank you very much. Couldn't get that out. A big round of applause for Rowan Marley. Thank you so much for coming to this panel discussion. Thanks for coming to Cannadelic. There's still one more panel going on. Zappy Zappelin's talking over there. We took over his spot here, so they moved him over there, as far as I know. Oh, he's in here? I thought he told me. Okay, I'm wrong. I thought you told me he moved him over. Then he's in here, and we're ready to go. That's false. All right. Oh, he's staying here. Okay, sorry about that. False alarm. So we're having Zappy here, hang out here. We're done with this panel. Thank you so much, and come back tomorrow for day 2 of Cannadelic.
Where are you gonna be? I'm gonna go to my room. I gotta charge my phone. Are you gonna be at the dinner at 7? Yes, I'll text you now. Nice to meet you. Yeah, I listen to you. I listen to your dance music every day. I'm not lying. It's really an honor to meet you. Thank you for your heart, your love for people. It's beautiful. You live in Miami? Yeah. All right. Yeah. My buddy is Ian Hayes, so you know. You don't need a table either? Okay. Keep it standing by.
If my words get low with the cold hard sunshine, and my tunes were played on the harp of the sky. Would you hear my voice come through the music? Would you hold it near as it were your own? It's a hand-me-down. The thoughts are broken. Perhaps they're better left unsun. I don't know.
Everybody take a seat. We're about to get started.
Let there be songs to fill the air. Ripple in still water.
Lights. Lights. Lights.
It is now time for the keynote speaker. As the director behind the acclaimed documentary, The Reality of Truth, which follows actress Michelle Rodriguez and friends on a deeply personal journey of discovery. He is often called on as a psychedelic concierge to help celebrities, thought leaders, and business icons have a conscious transformation. Known as a visionary and futurist, he has been spotting trends for decades, such as internet domain names, legal CBD and cannabis, and now the burgeoning psychedelic economy. As the youngest vice president in the history of one of Wall Street's most successful investment banks, he is a frequent commentator on the emerging psychedelic industry and investment opportunities. Put your hands together for the Cannadelic Miami 2022 keynote speaker, Zappy Zappolin.
I'm Zappy Zappolin. I found out about a hidden technology in nature that's been used by ancient civilizations and cultures throughout the world from the beginning of time. This ancient wisdom may be the answer to our modern problems. It's so controversial, it's been hidden by many governments, large corporations, and organized religions. This answer is so guarded that I had to go undercover to search the world for its keys that were hidden in the cracks of ancient cultures. So I partnered with my close friend Michelle Rodriguez to traverse the world to find it.
At approximately 3:15 p.m. on October 13th, 2015, a call came into the Nye County Dispatch Center for an unresponsive male experiencing a medical emergency at the Love Ranch.
Blood coming out of his nose, white stuff coming out of his mouth.
The patient, identified as Lamar Odom.
Odom is on a ventilator in a coma. Multiple drugs were found in his system, and there are reports he used synthetic Viagra.
My doctors told all of my loved ones to say your final goodbye.
Demonstrated evidence of multi-organ system failure, multiple strokes, significant cardiac damage, kidney damage, liver failure.
Lamar, he lost his mom at 12 years of age to colon cancer. How can a kid go through that? And then his father had a substance use problem on top of it.
My grandmother and my son died on the same day, 4 or 5 years apart, in the prime of my career. And when that happened to me, I felt like I wanted to quit.
he was a wounded individual, but in the right time, in the right place, with the right help, he could blossom.
When Greg called me to come to Florida to do the ketamine, I thought it was nuts. I'm all about getting better, especially at this stage in my life. But doing hallucinogenics is something I've always been trying to stay away from.
It's time for liftoff. You ready?
Yes, sir.
Lamar,
Whoa.
you're on a journey.
Yeah.
Try to just be with it.
And I told him I've been preparing him for something big, the most powerful plant psychedelic known to man.
If you might set a purpose, you might start preparing yourself and getting in touch with aspects of themselves that have been elusive, very important aspects of themselves, and probably account for some of why they're suffering.
He likely has suffered from chronic PTSD that has re-exacerbated over time as more traumas have occurred.
I just want to be better. Get rid of addiction, anxiety. If I can help all that out with just, a treatment like this, then why not? Why not give it a shot?
Hi, everybody. Thanks for being here. I want to thank Cannadelic and Colleen and Pete for sure. I met them about a year and a half ago, and it seems like just yesterday. But as we were talking about psychedelics and experiencing them, I'm sure this idea was kind of germinating right there. So I want to call them out. And, I want to, in my talk today, really, for me, I believe psychedelics are the thing that is going to save society right now. As much as I love cannabis and I've been using it for 30 years, pretty much every single day, I don't think it can heal the situation that we're in, this mental health crisis that we're in. And the reason, I'm going to talk about the future of psychedelics. And for me, this is a really important moment because we have to address a very serious issue. This is Ray Kurzweil. He's a futurist. He's the chief science officer at Google. And Ray Kurzweil says that in 2040, year 2040, 2045, we're going to hit something called singularity, where humans are integrated together with technology. And you may have seen Elon Musk has a company called Neuralink. And Neuralink is basically attaching a node to the back of your brain, into your brain. That's going to be connected to the internet, and you're going to have AI running calculations on what you should do. And according to Ray Kurzweil, in 2045, human beings that are connected to the internet with AI are going to be 1 billion times more intelligent than they are today. So 1 billion times more intelligent means that any single person that's in that situation could probably destroy a city, destroy the world. You imagine a high school kid breaks up with their girlfriend or boyfriend and they have that kind of power and says, oh, I'm going to destroy Miami today. That's the kind of power we're going to have in 2045. And I'm not going to wait until 2044 to start really going hard at this, because I think we need to expand consciousness now and get a critical mass of people to expand their consciousness so that we can handle that level of technology, that level of power. And like I said, I love cannabis, but that's not going to do it here. We're going to need psychedelics that can cause people to have instantly more empathy and raise their energy level. And so as I think about the opportunity that we have now, groups like this that are very early, we have to get a critical mass of people to do psychedelics as soon as possible. And I think when we raise consciousness up to that next level, when we get these kinds of powers, that we could handle them responsibly. And so this is a really important moment when you think about that. And I think, for me, this is what's driving me. This is why, as a psychedelic advocate, I'm not just sitting back and, enjoying the ride and waiting on everybody else to catch up. It's like we really have to do this right now. And so this is important. I'd like to tell you, before I tell you about where the future of psychedelics are about to go to, I want to go a little bit into, how I got myself here. And not sure. Am I doing this right with the clicker? Sorry. Lee, I might need a little bit of help on this. That's okay. I can do it from the pad if that's good. Okay. So this is the first film that you saw the trailer for, and we were really excited. We won the Amsterdam Film Festival Van Gogh Award, but what's more exciting is that about 15 million people have now seen the movie on Amazon Prime, YouTube, and according to some calculations, that potentially 1 million people have done plant medicine because of the movie The Reality of Truth. And how amazing, really, thank you. You know, Michelle Rodriguez, who's in the movie, her arc of what you see happen to her during the movie is incredible. And that movie follows her for a few years after that, where she goes through some really significant trials and tribulations of her friend Paul Walker, the actor, dying. And just, she said to me, you know, how I handled that was so different than how I would have handled it. And rather than being, you know, upset or, you know, maybe even, you know, I don't know, killing yourself or something, that she kind of looked at it like it was a positive thing, like he had gotten there before her. And she, you know, in the movie says that the psychedelic, the medicine basically destroyed everything she'd ever believed in before. And she was happy about it. And that's the experience of psychedelics. And, you know, when I got the opportunity to create The Reality of Truth and I came back into, you know, regular Western society after being in Peru and doing plant medicine with the shamans, I started going around telling everybody about plant medicine. It was just, I couldn't stop talking about it. And I kept telling people, whoever it was, George Lucas, Oprah, Kim Kardashian, you know, I just kept on saying to these, you know, people, like, this is really the next thing. This is what you have to pay attention to. This is what's going to save society. This is what's going to solve your own mental health issue. And a lot of people that I was saying it to, they couldn't really accept, or their families maybe couldn't accept that they wanted to go do this plant medicine with a shaman. It just didn't seem right. Some of the people who had addictions and things, you know, they would say, Zappy, my family is not going to let me go down and sit with a shaman. They will probably put me in a mental institution right now if I tell them that. So I had to try to figure out, is there a Western medicine approach that people could have the same experience? And in that time, I wound up finding ketamine. And ketamine, for people who don't know, is a really amazing drug. I'm going to show you, this is just to show you what ketamine's all about. This is a brain. The green is showing regular brain activity, and the red part is showing where additional brain activity is taking place. You can see this is on psilocybin mushrooms. There's a lot of red firing activity in the back of the brain. This is your brain on LSD, a lot of activity taking place. And this is your brain on ketamine. So this is basically 80% of your brain is active. Ketamine's a dissociative. So it's basically dissociating your left and your right brain and allowing them to communicate without your ego getting involved. And when that happens, you can do a lot of processing, but in the hours after your ketamine treatment, medical ketamine, I should say, you metabolize the ketamine, which turns into this hydroxynorketamine and actually builds new neural pathways in the brain. So this is the limitless drug, like you've seen the movies about the limitless drug. Ketamine really is that. And I convinced a doctor down here in Florida in 2015 to allow me to do the treatment. And I told him I was like a little depressed and all that. And he agreed to give it to me. And as soon as I did it, I was like, I knew this was part of the rest of my life, because this was an experience where I describe it as where I went into like a present moment awareness state, where all the chatter in my head just stopped completely. And I was able in there to, kind of look around, look at from a third party perspective at some of the things in my life, and then be able to come out of that. And I just started, again, now telling everybody about ketamine as the way out. And for Western society, because ketamine's FDA approved, it's something that most people can handle. They can't handle go to the shaman in the jungle, but if it's go to the doctor down the street, FDA approved, that's approachable. And so I said, okay, this is really where I need to focus my attention. I think this is the thing that's probably going to be the gateway for people to, come into psychedelics in a way that they can handle. And so I want to tell you a couple anecdotal stories about ketamine, because this is an incredible compound, I'll call it, but it is a miracle drug in itself. It's a microcrystal, and so it's always uniform. It's all the same. People tend not to have any bad trips on it. In nightclubs and things like that, people are snorting ketamine, which goes to your nasal receptors, and it can cause some addictive response. But when you do medical ketamine, either in an IV or an intramuscular shot, or you take a lozenge, you avoid that and you get just really the good part of the experience. And a couple experience I want to tell you. This is a doctor. He's a Harvard medically trained doctor. He had never done psychedelics before, comes from a Islamic family, Muslim family, and he had never done it before. I kind of coached him to be ready to do it, and he did it. The first time he had a great experience, and then with ketamine, you want to go up in dose so that you actually dissociate. I'm not sure the first time he did it, he dissociated. The second time he did it, he had a full dissociation, and he said that in there, he had denounced the religion, 50 years earlier, and he didn't want anything to do with it. He told his family that he could be conscious and ethical without religion, and he was out of the family. And so in this ketamine experience, he met God, and he was there talking with God, and he said, when I leave this experience, I'm not going to, probably remember it, or I'm just going to think it's a trick of the brain. Like, you have to give me some proof. And he asked for it, and it kind of tried to shift him a little bit. And he said, no, I need proof. And it kind of tried to trick him a little. He said, I demand proof. And he said at that point, he floated up over his house in Massachusetts, and he was floating over. He was looking at his roof. Said he's got a slate roof. He's never been up there. He said birds won't even sit on it. And he looked down, and one of the tiles was cracked in the roof. And he said, oh, that's interesting. And he came out of the experience, and the next day he went to Best Buy. He bought a drone, and he had his son set it up, and he flew the drone up on the roof, and the exact tile was cracked on the roof. So what is ketamine capable of is, potentially anything. I have another story that I like to tell, anecdotal story. I used to sit with people when they did their ketamine treatments in Boca Raton at a doctor's office, and I would just sort of meditate while they were having their 45-minute experience. And a woman came from California. She asked me to sit. It was the end of the day, around 5 o'clock, and I started getting hungry at the end of my meditation. My stomach was growling, and I started to think about what I was going to eat for dinner. I was thinking about going with my daughters, and I was like, oh, I'm going to not eat the French fries today. I'm going to get the baked potato. I'm going to play it safe. I'm going through this whole thing. And the lady comes out of her ketamine treatment, and she said, oh, Zappy, that was the best one yet. She's like, I was going from dimension to the next dimension to the next dimension. She's like, all of a sudden, this giant French fry showed up. And I was like, oh, shit. Like, you really got to be careful about what you think. You're projecting that energy, and in that state, you can really tap into some of that stuff. With my colleagues at CannadMD that I'm going to show you, we've been doing some group practices throughout the pandemic. We've gone out to Silicon Valley to some well-known companies and sat with their executive teams, and we have these group keditations, we call them, where we clear everybody for ketamine. We all sit. We have a modern day plant medicine ceremony, and we put an intent on it. And then we take the medicine, we listen to the same frequency-based music, and we have that experience. And then afterwards, we'll have like a share session. And there's some incredible ESP type stuff that happens during that session that is completely undeniable. You just afterwards, you go up to the person, you're like, well, we had the conversation about this, that, and this, and they're like, yes, we did. You know, it's that kind of a thing. And the companies that we do it for, a lot of them have said something like, you know, what we just did in 2 hours would it take with our team would have taken a month in the wilderness together, because all that backstabbing and things, it's gone. Empathy level, we're all a cohesive unit now, and this is one treatment for these people. So it's a really magical situation. I said this a little bit earlier in my talk, but the science on the ketamine is that you have this default mode network in your brain, and that is in there. There's this mechanism called your lateral habenula that's recording all the stress you've ever had in your whole life. If it becomes too much, your brain goes into burst mode, which is a completely different brain state, and it shuts off your dopamine production when you're in burst mode. So that means you're getting no happiness, no motivation, and as soon as you do a medical ketamine treatment, it takes your brain out of burst mode, and you immediately start getting that dopamine back. So I joked earlier, we get all kinds of calls the next day from people, and they're like, oh my God, my husband just cleaned the garage. He claimed he was going to do that for 5 years. Whatever you're doing, keep going. And really, that is the effect that people are getting. So medically speaking, this is, you know, 75% effective in the medical journals. I would say I've seen it be 90+% effective against even treatment-resistant depression. But again, the better the set and setting is, the higher the effective rate's going to be. So what happened was I was showing my movie, The Reality of Truth, one night at Hippocrates Health Institute here in Florida, and somebody came up to me and they said, hey, I'm friends with Lamar Odom. He's not in a good place. Do you think you could talk to him about plant medicine? And so I went and met with Lamar, and I said, hey, you know, I think ketamine is probably, he'd never done any psychedelics. He'd always been told to stay away from it. Bad, you know, you could go crazy. You could get shot by the cops, put in a mental institution. He always avoided it, but he tried everything else at that point. Nothing was working. And so he was willing to trust me at that point. And I brought him in to do the ketamine. This is actually me showing him those 3 photos I just showed you guys. And he was like, shit, I need that. So this is Lamar's before and after photo. This is on Monday when I met him in the park. And this is 1 minute after his ketamine treatment. And you can just see, you know, he was like a kid. He just said, I never felt this good in my whole life. You know, and as a testimonial, like, what's better than that, especially given, you know, this is a guy who's had all kinds of incredible experiences, but he'd never been able to he was always masking trauma that he had in his life with his mom dying and had a 6-month-old son die. And just all the drug use that he was doing was just to kind of cover up that pain when he went home at night. And, you know, just the difference that I've seen in him has been incredible. Got him wearing the glasses. He became a true believer. After that, you know, when he stabilized, I said, Lamar, I think with your addiction profile, I think you need to come with me down to Mexico to do ibogaine, which is an African root that can break a heroin addiction. And I said, with your addiction profile, I think the ketamine might have stabilized you, but if you want to break this thing and really rewire your brain and your physical, you're going to have to come down to Mexico. And Lamar agreed to come down, and you know, he got into bed, and it's something that has to be supervised by a doctor because it is cardiotoxic. Your heart rate does go down, and you just need somebody there to support you if that is the case. But the ibogaine is one of the most incredible experiences that you can have. Let me go back here for a second before I show you that. You know, it's basically a 12-hour to 48-hour experience where you're gonna, the Bwiti culture that uses ibogaine in their rituals, it's an ancestor-based culture, so they're using it to go back and to get in touch with their ancestors. And in that experience, Lamar got to hear his mother's voice for the first time in 20+ years. He got to see his son. You see in the movie him talking about it, but he had a son that died at 6 months old. He saw the son at 6 months old. Then he saw him grow to be like 8 or 9 years old. Then he got to see him the age he would be today as a teenager. And he's like, just to see my son and hear my mother's voice, he's like, I wish this for everybody who's lost somebody. This is really the magic bullet of that. And the ibogaine does a physical reboot on you as well. It goes to work on you mentally, but like you saw, Lamar had 12 strokes and 6 heart attacks. And when I met him, he was, kind of a little wobbly. He wasn't, in shape to play basketball or anything like that. About 24 hours after the ibogaine, maybe 48 hours after, we were driving back to LA, and Lamar was in the van with us, and he said, you know what? I feel so good physically and mentally. He's like, I think I can make a comeback in professional basketball. And we were all like, wow, that's cool. And his trainer was with us, and he was like his bodyguard trainer. He's like, Lamar, dude, take it easy, okay? You'd have to work out 4 hours a day. You can't be smoking weed. And Lamar was like, I know what I got to do. I'm doing it. And he trained for 6-7 months, and he went and played in a professional tournament in Dubai for the Philippines professional team. And it was like a personal Rocky moment for him. He said that, he knows he's not the same player that he used to be, but just to be able to get out there on the court and to be able to, live that moment for himself, he never thought that was possible. And, he's just continued to get better and better. Him and I have done some other psychedelic experiences. This was out in the desert out in California. I'll leave it to your imagination what was going on over there. But, when the pandemic hit, my business partner, Warren Gumpel here, and we were looking for a way to make ketamine more available because it is expensive in clinics. We wanted it to be more accessible. And we came up with the concept of KetaMD, which is to be able to give people a lozenge that melts under your tongue, goes into the mucosa, and you basically have the same experience that you would have in the clinic, you're having it in your home, in your own bed. And it changes the game on it because it makes it accessible, but at the same time, being in your own bed in your safe set and setting really sets you up to have an incredible experience. KetaMD, we monitor you. You have a nurse over telemed that's guiding you. You're listening to our frequency-based music, and it's really an incredible experience. It's like the ones that we do for the corporations, but you're doing it, with a nurse. And I have to say, the psychic connection that you have with that nurse is a real thing. It really comes through, and people, feel safe, and they have as incredible an experience as if they were in a clinic. And so Warren and I had Lamar start to do his at-home treatments, and we would go and we'd, guide him and we'd film him. And he's going to be a great advocate. Right now he's on Big Brother, Celebrity Big Brother, and I've been told that he's already been talking about ketamine and KetaMD and his experience there. So if any, you guys are in Florida, we're coming soon here in Florida where you'll be able to do it. And it's a great experience. Everybody that does it says this is a top 3 experiences of my life, up there with having an orgasm and having my kids. This is like that level of an experience. So we're excited. This is, Lamar's a great spokesperson. I think when the movie comes out shortly, he's going to be really the spokesperson for it's okay to talk about mental health. And especially in the African-American community where it's kind of been frowned upon. Lamar makes some pretty bold statements in the movie about, it doesn't matter, if you think it's weakness, you're wrong. If you don't have your mental health, you really can't accomplish anything. So, this is him doing a treatment. And I want to talk to you, as I talk now, this is getting into the future of psychedelics. And this is a company I started with some really incredible biotech, bioscience people, companies called Psychoceutical. The best of psychedelics meets pharmaceuticals. And what we're doing with Psychoceutical is these are patents. This is a company that has patents that work in the pharma industry that we're bringing over to psychedelics that are about to change the future. Because if we want the medical establishment and the government to be okay with everybody taking psychedelics, we have to make these things mirror the pharmaceutical drugs. And so that means they've got to be the same every time. They've got to be safe. We want people to take as little medicine as possible and get as much bioavailability. And so these patents are, one of them is a patent to put the topical cream at the back of the neck at the base of the hairline, whether that's ketamine or psilocybin, psilocin, any compound, to put it at the back of the neck at the base of the hairline, goes directly into the nerve tissue, directly to the brain, and it avoids your entire systemic system. And all the side effects of psychedelics happen in the systemic system. So we can actually, you can put ketamine here on the back of your neck, and you will not have a psychedelic experience, but you will immediately feel a readjustment, your energy shifting, anxiety going away, and some of the things like nausea and dizziness and lethargy and things that could be associated with the systemic system are eliminated with the psychoceutical. Another patent we have is developed at University of Michigan. It's a nanoparticle solution where you can take any molecule, any psychedelic molecule, combine them together, or any other complementary compound, put it together in a nanoparticle in very small sizes and in different shapes. And in one case, this was developed for oncology drugs and cancer, and they found that triangular shaped molecules have a significantly larger uptake than other shaped molecules. So we're going to be able to make these any size, we're going to be able to target with the molecule, and we're going to be able to combine other molecules. So we can have one tincture that you take, or a nasal or topical, you take it, it goes into your body, and then every half hour, whatever we program, a layer comes off and you get the next dose. So this is going to allow for equal dosing, microdosing, but also the opportunity to put compounds together. So we're imagining one of our first ones would be something like, you take it, you get an anti-nausea first, then you get a ketamine treatment in there, and then an hour later, let's say you get CBG or something that's going to enhance that experience. So without people having to take the medicine, ketamine, a lot of people try to microdose it, and it's very hard to remember, did I already take it? And you don't want to take it every, hour or 2 hours. It's not right. So if you could take one tincture and the layers come off, and now you're getting your medicine properly and in a low enough dose that you're getting the maximum bioavailability. To me, this is the future of psychedelics, because this is how we make it pharmaceutical grade and we make doctors comfortable. A doctor's never going to say, oh, mushrooms, psilocybin's good. Why don't you take a cap and a stem and let me know how it goes? It's just not going to work out. They need psychoceuticals. So I'm very excited to be involved with this company. And I think really, when you think about the future of psychedelics, this is, the more we can look like a pharmaceutical, we're going to accelerate the uptake of psychedelics within society and the medical establishment. And I was saying earlier, I don't think there's a conspiracy to keep psychedelics from society. I think it's just a complete lack of education. The doctors do not know about psychedelics. They don't even know about nutrition. So if they don't know about nutrition, which could solve all the problems that they're working on, they certainly don't know about psychedelics. It's up to us, the psychonauts, the people who are here today, to educate them, to be the voice, and to train them, and to coach them, and make them comfortable. And so that's what I've been trying to do, is just reach out to influencers and medical people to be able to do this, so that more and more people can access it. When we talk about the real future of psychedelics, this is a really incredible moment to realize that frequency psychedelics are what's coming next. So the opportunity, rather than taking a substance, and there are companies right now that have products that exist where you take let's say you take vitamin C, and you're doing that you're taking an orange to get vitamin C. As you take that, there's a chemical reaction in the body, an electrical reaction in the brain. That's why you're taking that orange. Right now, the opportunity exists to put on some headphones, to be given a frequency through a speaker, through headphones, and to be able to send somebody vitamin C frequency, and you get the same electrical reaction, chemical reaction in the body. You don't have to take the medicine. And so for me, this is really the future of psychedelics, will be basically total democratization. So if you live in Alaska and you can't get your hands on any psychedelics, you're going to be able to get frequency-based psychedelics. And the company that is behind that has a product already where you can speak into an app for 30 seconds. It'll tell you if you have coronavirus within 90% accuracy just with the frequency of your voice. It'll also, tell you what vitamins and nutrients you're deficient in based on the frequency of your voice. And then from there, they have headphones and some other things where some folks like Taylor Swift and Will Smith and some people have these headphones, and they can program them to give you whatever vitamins and nutrients you need. This same company has developed a patch that goes on your skin. It's a transdermal patch. It doesn't have any medicine in it. What it has is it has a crystal structure in there, and they clone the frequency of whatever it is that they want you to have. They then, in a plasma lab, they put that frequency onto the crystal structure in the patch. You put the patch on your skin, and it starts to emit the frequency. So I've tried these. They're incredible. I tried their psilocin patch. They call it a calm patch, and it has the frequency of psilocin. And you put it on, and a couple minutes later, you're just, all of a sudden, you're calm. And we've been giving these out. We've given them out to, probably hundreds of people at this point. And the evidence is overwhelming. It's just, works incredibly well. Had a billionaire family try the patch recently, and the woman, she was not really into psychedelics. I was having this conversation with her, and I never thought I'd even talk to her again, but gave her some patches on the way out. And the next day she called and she said, "Oh my God, those patches, like, how do I get more? Can I buy it? Can I buy the company?" The whole thing. And she said she gave them to her daughter, who's an equestrian jumper. And she said that the girl really performed incredibly well with the patches, and that she was going to save the ones that I gave her just for like competition day. And I can tell you, having tried these patches and having tried some of their other psychedelic products, that this is very real. And it caused me, with my producer, Kaya Roman, who you see there, who's here today, we started to go around and investigate a lot of these frequency-based products, because this is really the future of medicine. This is the future of agriculture, future of psychedelics. The same company has a product where, for agriculture, where the farmers, when they're going to water their field, they put the water through this device. That's a frequency device. It structures the water, and then they spray the field with the structured water, and basically they don't need any fertilizer, any pesticides, and the yields are higher than the other fertilized pesticide field. So the reality is, what they're doing is, they're putting, for example, if it's corn, and I'm making this up, corn, if grasshoppers are eating your corn, what they'll do is they'll put the frequency of whatever it is predatory to the caterpillar, like a bird or something like that. They put that frequency into the water, and the caterpillars just avoid the whole thing. So this is really about to be the future of everything. This is a movie that we're putting out. It's called Frequency: The Future of Everything, and everybody from Dr. Joe Dispenza and Greg Braden, Nassim Harriman, Bruce Lipton, on and on. These folks talked to us about frequency and showed us what they're working on in this regard. I know a lot of people are familiar with Dr. Joe Dispenza and the work he's doing, where he's training people to put themselves in a certain frequency state, and then that to be able to heal people. And they're putting groups together. They'll put 10 people with, somebody who's got cancer in the middle. Everybody will get into that frequency vibration and put that on the people, and they're measuring the results, and it's really an incredible thing. So this is where I think for sure the future of psychedelics are going. And, this is a little bit of just some of the travels, some of the frequency devices and some of the opportunities that exist to use these things to regulate your own frequency. This is Nassim Harriman in a chamber where he charges these arc crystals, and he's basically taking this crystal and putting the frequency on it. And when you think about ketamine, it's a crystal, so it can hold information. And the opportunity here is to take the psychedelic products that we have at KetMD or the psychoceuticals and to put a frequency on top of that. So to be able to allow people to take, have multiple levels of benefit from these products. And so this is going to be 5 years from now. I predict that this is going to be, the norm. You're going to go to the doctor and he's going to say, yep, you're deficient in B12. We'll send you the program, listen to it tonight, and you'll be ready. And the psychedelic stuff, so powerful, the ketamine, when you do that, it really is a frequency vibration that's happening. You feel this frequency. It's a very high frequency, and it allows you almost, in my opinion, to kind of come back to whatever your original frequency is. And when you walk out, you're kind of resonating your own frequency. And so this is, the future of where we're at. I want to, say that I think the next opportunity that everybody in this room has is the opportunity to do well financially from the psychedelic industry, because we're all very, very early right now. The fact that you're sitting here, you're in the, 5% of society that knows what's going on. And similar to the internet happening or cryptocurrency happening, if you're early in these giant mega trends, you are going to make a lot of money. I've been working with a company called Palm Beach Legacy Research, and we're putting out a newsletter. This is Tika Tawari. He's a famous cryptocurrency guy. We're putting out a newsletter about psychedelics and alternative medicines and things like that. And, the opportunity right now, you've got dozens now of psychedelic companies that are publicly listed. These companies, they were a great buy 6 months ago. The market, when crypto went down and things have gone down, these stocks are, 70% below, 50% below where they were. But what's great is that all the science and all the research that's happening with psychedelics and all the legislative things that are happening, it's an incredible time for psychedelics, better than it was 6 months ago, better than it was a year ago, and these companies are cheap. So you get the opportunity to buy psychedelic companies because you're in the know right now. And this is like knowing about, Bitcoin at $400. We all in this room should be the ones that get to benefit from this opportunity because we're early. And I've been early in some trends like domain names, where I was able to buy domain names like beer.com and diamond.com and creditcards.com. And just being early, you didn't even have to really do anything. I bought beer.com for $80,000. A couple months later, I sold it for $7 million. So it's just being early and knowing that in the psychedelic space, these companies that you're buying, it's like buying a pharmaceutical company in the 1920s or a biotech company in the 1990s. You have an advantage over everybody else out there in society. All the people that you see on TV that are talking about stocks and bonds and this and that, they don't know about this. So I want to really encourage everybody to, leverage the fact that you're early, own these companies, buy them, don't look at them, just put them away. And as rescheduling of psychedelics happens, where they go from Schedule 1, where they are right now, which is, completely illegal and said to have no medical benefit and to be highly addictive, when they go to Schedule 2 or Schedule 3, where ketamine is, the opportunity is going to be absolutely huge. All these stocks are going to go up 10x, like the cannabis stocks, as legalization and things happen. And we have the opportunity here, as those catalyst events happen, you're going to be able to make money without even trying. So if you're timid about getting in, you don't know what to buy, there's actually something called an ETF, and it's an exchange traded fund. It's a basket of all the top psychedelic stocks, the largest ones, and you can just buy one stock, this one ETF. I believe the symbol is even like PSY on that, and you can buy that and you'll have a basket of stocks. Some are going to be not they're probably going to go out of business. Some are going to do well, and some are going to be the pharmaceutical companies of the future. So the opportunity here to own today, especially today where all these stocks are down and the market's down, to own these companies is a huge advantage. Whatever you guys paid to come here, if you put that much into a psychedelic fund right now, I think you're probably going to, 10x that one day when rescheduling happens or legalization happens. And it might be 100x if you're in the right companies, because that's what's happened in crypto. That's what's happened in biotech. And, when I think about psilocybin mushrooms that I believe are going to replace probably all the antidepressant drugs out there, that opportunity to be part of the transfer from pharma or, what we were using over to psilocybin, over to frequency, we have a great opportunity here. Anybody who's here to be involved now. And so I want to encourage that for sure. This was a couple weeks ago in Miami. I was with Jordan Belford, and I want to also suggest as a futuristic opportunity for everybody that everybody become a psychedelic concierge. And that means that you are helping people to find the right psychedelic formula for them that is going to work best for them. I also would say that before you become a psychedelic concierge, whatever medicine is that you're promoting, that you should have that experience yourself. But if you've had that experience yourself, you're in a position to guide other people. And it's sort of compound by compound. So if somebody's done, psilocybin mushrooms and MDMA, but they've never done ketamine, they're probably not in a position to guide somebody who's doing ketamine, because the language, the experience, it's completely different. But once you've had a couple ketamine sessions, and you can hold space for somebody who's going through that experience. And so this is a great opportunity. It's very lucrative. A lot of people need this. They want to be guided. They've never had the experience. Jordan Belford, the Wolf of Wall Street, who was played by Leonardo DiCaprio in the movie, he'd done every drug under the sun, but he'd never done any psychedelics, and he was scared. And so a couple weeks ago here in Miami, gave him a psychedelic experience. He said it was a profound experience, was what he said. He said that he had, the word that came to him was gratitude. And he just said, I'm so grateful for all the people in my life, and I'm seeing how grateful I should be. And so, when you're a guy like this who's had a lot of trauma and drug use, and you've done some negative things, and you're, trying to reconcile all that, cannabis is not going to do it. Talk therapy is not going to do it. Antidepressants aren't going to do it, but psychedelics are going to do it potentially in a single session. And if you're with the right practitioner in the right set and setting, you should expect to have some kind of a massive breakthrough with even potentially one session. And, ketamine, we always recommend that based on where somebody's at, they should do a series of treatments, because in order to it's like if your foundation is weak in your house, you need to build that foundation up. So just putting one thing of blocks there might not do it. You really probably have to foundationalize the whole, foundation, and you have to do that with your own brain as the ketamine metabolizes and builds these new neural pathways. These are neural pathways about, I'm here and I'm going into the future. And so those are important. I've found that in the ketamine, when I've done it, I've been able to try to have an experience where I think about something that happened to me that was negative, and I look at the experience kind of from a third-party perspective. When I come out of it the next day, it just doesn't have the same electrical charge on it. It's not that it didn't happen, but it just doesn't have that charge. And so this is an amazing opportunity. I think all of us, we're totally blessed also to be here in Miami, because Miami is shaping up to be, really the psychedelic place for business, for science. The opportunity is really happening here. The art scene, the social scene. It's set up for people to come here and do psychedelics, and for the people who live here to access, the opportunity to be involved in the business of it. Because a lot of people left California, they left New York, and they've now come to Miami. And there's a lot of psychedelic companies, as you can see, here today and in general that are taking place here in Miami. So we're all really blessed to be here in this place. I think the opportunity we have to be, so early in this is exciting. And I want to, encourage everybody. This was just last weekend. I went out to the desert with some friends, and this is in California in Death Valley. I'm standing there on that dune, and it's like you're on Mars. But the reason I did this and what I want to encourage is that, we're all busy and life is very, coming at us really fast, but it's really important to take the time to go inside of yourself and to try to get some silence and to get some answers. And those answers are inside of you. And so in going out there, again, there was all kinds of business meetings I should have been at. And I said, no, I have to go to the desert. And when I went out here, it was incredible because there's no sound. This is Death Valley in California. There's no bugs. There's no birds. There's no traffic. There's no electric wires. This is complete silence. And when you're moving along, you hear yourself, and as soon as you stop, it goes into this deafening silence where you can even sometimes hear the blood, flowing through your body. It's the only thing you can hear out there. And it was incredible. We did a number of psychedelics out here. And to be out there and do that was transformational. It's very rare, I think, these days to be able to find silence, true silence. A lot of people say, well, yeah, I go, I put my noise cancellation headphones on, but you're hearing this shh noise in there. But to get to this level, I encourage everybody, if you can't do that, maybe you got to sit down, on the beach and do a microdose or a flood dose of psilocybin, whatever it is that can take you inside. These days, when I've been doing personally my own macro journeys, when I've taken 5 or 6 grams, I go into total silence. I put on the eye shades, no lights, and I don't come out till it's over. But those are some of the most transformational experiences. When I've done psychedelics in concerts and things like that, it's fun and whatnot, but I'm not getting in touch with myself. And I think right now, the world's moving so fast and we're getting so much media and so much information coming at us with technology that our brains aren't even able to handle, that you got yourself in a situation where the psychedelics, probably the ketamine, I'm theorizing that the ketamine is basically here to help us to evolve our brains even quicker because of this crisis that we're in. This is something that can kind of give us a quantum leap in our brain so that we can handle this level of technology or filter out the technology in a healthy way. And so, I'm always thinking to myself, my advice to people as a psychedelic concierge is go inside your mind, trust nature, and don't take anything too seriously. And I think when you go into it with that approach, you can't help but have a good experience. And if you have good people around you, you're going to have, probably the breakthrough that you're looking for. And you're going to be developing your brain in a way that the rest of society is not doing right now. And in a few years, you're going to be so far ahead of everybody else that they're going to have to play catch up. And to the Ray Kurzweil point, when the technology comes that makes us 1 billion times more intelligent than we are today, we're going to have some tools. We're going to have an expanded consciousness so that we can all, get through that and not destroy everything. And so, I don't know. I just want to talk lastly about, this is my nonprofit 501c3. It's called the Mind Army. And the Mind Army is fighting for the right to pursue happiness. And we believe that everyone deserves the right to go inside their own mind for answers and healing. And this is 2022. We're not going to sit around. The Mind Army is getting very radical. We invite you to join, but we're not going to do what the cannabis industry did and talk to the state and the city and the DEA. We're not doing it. We're saying we're in a mental health crisis and we are accessing these God-given materials, and we're going to take these for the betterment of ourselves and our family. So we don't accept, the Mind Army just doesn't accept that society, when they made these compounds illegal in the 1970s, they said, we're doing it because we have to study this to make sure it's safe. Well, now here we are 50 years later. Millions of people have had this experience, many with great benefit. We're not going to sit around and have people tell us that alcohol's good, tobacco's good, but psilocybin mushrooms, that's not good. And even if your family member is dying or yourself, you can't access it because we say you can. We're not into that at the Mind Army. So we're lobbying politicians. We are developing the funding and the lobbying efforts to be able to go in the same way that large corporations go, and they talk to all the politicians, and they use the money and the power. That's what we're doing here. So we are going to leverage the same tools that these corporations have. The Mind Army is going to get this legal now. We want an executive order from the President of the United States. We don't want to talk to anybody else. We want them to sign an executive order. That's when psychedelics were originally made illegal in 1966, was with an executive order making LSD illegal in California. So we want the opposite of that now, and I invite everybody to check out themindarmy.org, become part of it. This is definitely the most radical organization in the psychedelic movement. We don't care what it takes. We're not listening to anybody. We know that we have a mental health crisis and that psychedelics are the only thing that can bring us through that, and we're demanding it now. As an organization, we're just pretending that they're legal now, and we are acting like that within society. So that is generally where I'm at. This just so thank you. If anybody has a question or anything like that, I'm happy to answer it. Well, ketamine, when you do dissociating ketamine, you can't move. So you are, you're laying down with a pillow behind your head. That's how you're going through it. For about 45 minutes, you really can't move. It's one of the great things about ketamine, because a lot of other psychedelics, the thing that goes wrong is somebody takes it and then they go, I don't feel it, I'm going to take some more. And then they take some more, and then they want to wander out into traffic or into a crowd or something like that. So, yeah. 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 So the cardiotoxic was the ibogaine, the African root. That one is cardiotoxic, and it will lower your heart rate. It's, in the very few cases where people have died, it's because they basically shot heroin in the bathroom and then they came out and did the ibogaine. It wasn't the ibogaine that killed them. But the ketamine, really the only negative side effect can be nausea in a small percentage of people. The number one side effect is it breaks suicidal ideation immediately and is 70+% effective against even treatment-resistant depression. So no downside, just growing neural pathways in the brain. Yeah, well, this is where KetMD is trying to make this accessible to everybody, because in the clinics, this can be, $500 or more for a treatment, and you need to have 6 treatments, $3,000. That's inaccessible for a lot of people. With the at-home treatment, we've been able to get that down already to a couple $100s a treatment, and we have a nonprofit called the Ketamine Fund, which is giving away about 500 treatments to veterans, free treatments, and as we're able to give them the at home, we can continue to bring that down. And you got New Life here, which is a ketamine company. You've got some others here in Miami and around the country. I think the more clinics and at-home treatments we can have, it's just going to bring the price down, which is what we all need, because we're in a global society, and it's like you can't have your neighbors walking around like zombies. It's not going to be good for you. You have to get these people treated. So if we can get this, the ketamine, in reality, it only costs about $2 or $3 per dose. All that markup is in the doctors and the insurance and all that kind of stuff. But, the VA, the medical establishment, could be using this for veterans for $2 or $3 per ketamine dose. And we're hoping that some of the things that we're doing, are shedding light to the Veterans Administration. We've met with United Healthcare. They're doing a trial down in Austin, Texas, ketamine versus other antidepressants and other things, because they realize that, I think one of the amazing things that my partner Warren pointed out is that as big as the pharmaceutical companies are, we all think that they're the big guys that are controlling everything. Bigger than the pharmaceutical companies are the insurance companies. And the insurance companies, when they figure out and have the evidence that for $3 they can solve it instead of antidepressants, antipsychotics, talk therapy, having a panic attack and going to the emergency room, if they can compress all that down to a few dollars with ketamine, it's going to be the number one go-to. And so I think that's happening. We just have to continue to, advise, educate, and as the psychonaut community that's here, we're the ones that have to do it. There's nobody, they're not studying this in med school. So thank you. Yeah. Yeah, I want to say when they study it and they get the dosing right, I think there's going to be a dose for every single diagnosis. I've given it to people with DID, schizophrenia, and people always said, "Oh, don't give people with schizophrenia anything," which is it's like a wives' tale from a long time ago. It doesn't really have any basis in science. So I did at the clinic give it to somebody in more than one case, but somebody who had schizophrenia, and they told me that they were able to basically take all these alternate personalities and get them together in a room and have a conversation and say to them, "Hey, look, little girl, we're not going to die if we talk about this. So it's okay. You don't have to get all panicky anymore." And he was able to kind of have a meeting almost with these personalities. He stabilized himself enough, went down to Mexico, did ibogaine, did ayahuasca, and he's been down there in Mexico living, and helping other people where, he was like a schizophrenic person who couldn't even, walk to the store. And so I've seen this. I know, we don't know what the dosing is at all points yet because it has to be studied, but yeah, any ailment, I think this is basically the triage. And then, for Lamar, in the movie, his formula was ketamine plus plant medicine plus a daily practice like meditation or breathing equals a conscious transformation. And with psychedelics, each one has a certain attribute to it. So if somebody is disconnected from nature, maybe they need San Pedro. If they're, depressed in their daily life, maybe they need a microdose of psilocybin. They need a hug from their grandmother, it might be ayahuasca, ibogaine if they're addicted, but each one of them has their opportunity for healing. Yep. I don't know. That's above my pay grade, but the folks that are doing this have an incredible lab. It's a plasma lab. They spent, I think, $50 million developing this, but they basically, psilocybin, when you take it, it goes into your stomach and it turns into psilocin when it metabolizes. So instead of that, they just put the psilocin into the patch and they're delivering that frequency. So again, I'm not a scientist or a doctor, but having tried the patches, and I hope we will have those soon. We hope to have some microdose patches of all different types of compounds. No medicine in it, just the frequency, and they're really incredible. Yep. Yeah. Yeah. No, that's interesting.
since your level of suggestibility is so high, is it possible to create a patch with a frequency of something that you yourself program within yourself, so you literally become the cause of your own effect, which is your own life?
I
That's the
definitely,
question,
yes.
and that's the challenge
Yes,
for
that's
you.
a challenge.
I'm the first customer.
Aha.
Thank you.
I think it is possible because, like, you know, like we're talking about with B12 or these things that you're deficient in, to be able to give you the frequency of that. It's like, you know, if you wanted creativity, if you wanted joy, all these frequencies, they have a frequency, and to be able to put those together into a single patch would be amazing. Yes, yes. Gratitude would be a great one too. Yep. Sure. So psychedelic concierge, I think it's kind of an appropriate term, because if you imagine you go to a hotel like this and you go downstairs and you ask the concierge, hey, where should I go to dinner tonight? They're going to ask you a number of questions. What kind of food do you like? Do you like music? Do you like wine? Indoor, outdoor? And then they're going to make a recommendation. With a psychedelic concierge, we're really talking to people about, you know, what is your intent for doing this? What are your traumas that you're trying to heal from? And based on that, we can make a determination about what psychedelics would be best for that person, what combination would be. So again, like the concierge at the hotel, they don't cook the meal, they don't even get you the tickets, you get them from a ticket broker. They have the knowledge base, they have the experience, they've tried that restaurant, and they can say, you know what, based on that, you're gonna love this place. And I think it's such a great opportunity, because everybody, if you in your social circle, after you've had these experiences, if you can come to somebody and say, hey, I think you need to have this experience, I'll hold space for you. You know, that's really psychedelic concierging. But I think the bigger opportunity really is even to, you know, be versed in a number of these different compounds, and to be able to, you know, create a formula for people based on, you know, what they tell you about their intent or their traumas. So they're asking me to cut it, but I appreciate everybody being here, and congratulations for being some of the first people on the planet to deal with this.
We're looking at coffee with shades, brother. I need more of these. My one is actually making